and Andre White.
Yes.
And we sit back and we discuss our issues and concerns with the class. And I said I would bring you guys up for a good 5 to 7 minutes. And then I'm going to bring you back up after CMHA, Building and Housing, and Department of Health narrate to us. Okay. And we'll bring you back up, but I want you to start off. So Derek, you start off, and I got to get Spencer back to Pennsylvania.
Oh, you're going to start off.
I'll start off, Derek, and then Spencer, and then you got to get back to Pennsylvania.
No, I don't.
You got work to do.
I got work to do in Slavic Village. I was just telling the councilwoman.
Kamala Harris, man. You hear me? So let's move forward. And welcome back home to City Hall.
How are you doing?
I'm doing good. I'm doing great. Is this what you're going to narrate on? This
Yeah.
it right here?
Yeah, we
All
have
right.
our different
So we'll move forward.
You ready?
We can read it, yes.
Good morning to the chairman and council members. So we are members of CLASH. I am Ivanka Hall. I am the executive director of the nationally recognized Northeast Ohio Black Health Coalition, and I am the president and co-founder of the Cleveland-led Advocates for Safe Housing. We are all volunteer organization, largely self-funded coalition of 10 community-based organizations working to make Cleveland-led safe since 2018. We have been fighting for timely implementation of Cleveland-led Safe Certificate Ordinance and expanding the child testing for Clevelanders who are at risk for lead poisoning. One of the things that we need to make sure that everyone here understands is that lead is a naturally occurring element found in small amounts in the Earth's crust. While it has some beneficial use, it is toxic to humans and animals, causing health effects. Lead is particularly dangerous to children because their growing bodies absorb more lead than adults do, and their brains and nervous systems are more sensitive to the damaging effects of lead. Babies and young children can also be highly exposed to lead because they often put their hands and other objects that can be have lead in them from dust and soil into their mouths. Children may also be exposed to lead by inhaling lead dust from lead-based paint or lead-contaminated soil, or playing with toys that are lead-based paint, or eating food with lead in it. Lead poisoning occurs when the lead builds up in the body, often over months or years. Even small amounts of lead can cause serious health issues. There is no safe lead level in the body. Symptoms for children include delay in development, learning disabilities, difficulties, irritability, loss of appetite, fatigue, weight loss, vomiting, abdominal pain, hearing loss, constipation, seizures, pica, eating of non-food items like lead chips, psychosis, anemia, or aggressive behavior. Symptoms in newborn: babies are born prematurely, low birth weight, slow growth. Symptoms in adults: increased blood pressure, muscle and joint pain, memory and concentration difficulties, mood disorders, headaches, abdominal pain, reduced sperm count, miscarriage or stillbirth in pregnant women, psychosis, anemia, kidney damage. The diagnosis with lead is through lead levels in the blood, sometimes through x-rays of the abdomen, or sometimes x-rays of the long bones. In children with suspected long-term exposure to lead, the diagnosis of lead poisoning is based on symptoms and a blood test. That is why it is so important for us to make sure that the Cleveland Department of Public Health should conduct a program to test 100% of the children between the ages of 0 and 6 years of age who are living in CMHA units built before 1978. It is clear that the HUD IG report that no one knows how many lead-poisoned children are currently residing in CMHA units. Child lead testing in CMHA attendants should be provided on-site and at times that are convenient for the families. The Cleveland Department of Public Health has resources, 2 mobile vans, and the influence among private health providers to assure the speedy implementation of this plan. CLASH is willing to provide volunteers to assist with outreach and management of the health testing events. We thank you.
Thanks very much. And I want to say this. I like to openly thank you, thank CLASH, thank you, Carl. You and I have always been friends. You were activists. You're still an activist in the community, and she and I were friends as activists before I got on Cleveland City Council, and you've always worked in the community to help people. And the thing with Clash, you guys shine a light on it constantly, and that pushed legislation. And that's the same way with Dr. Martin Luther King. He shined a light on civil rights issues, on voting rights acts, and then that pushed legislation. So with Clash, and you were there also, my number one radical right next to me, Rebecca, council lady, those kind of things move policy. And we need Clash dealing with the this lead issue, and we don't need you guys to go away. Do you still have my cell phone number, or did you burn it
I
up?
sure do.
Okay, good. I know Andre reaches out to me, and sometimes I call Andre at 2 and 3 o'clock in the morning on issues and concerns.
Councilman.
I do.
Sleep.
Don't call me at that
2 and
time.
3. I wake up in the morning. Like, Andre, I'm already up, Kevin.
He's up.
You know, he's up. He is up. This stuff is serious for me.
And that's why I wanted to outline the symptoms for children, for young children and adults, because it's important for us to realize the lifelong impact. And I think that people, when we just talk about just pain only and not talk about the other things that are going on with our children, it's easy for us to dismiss lead. And we should not dismiss something that when you look at all of the things that lead does, it is indeed public enemy number one to public health in Cleveland.
Yeah, the cognitive behavior with children. Now, you know, you could always still call me at any time. I'm up. Sometimes I'm coming from a gig, playing, and you can reach out to me. We sit back and drink coffee to discuss issues and concerns that affect dealing with health or dealing with people in the city of Cleveland as well as in the county. And we were friends before you guys started doing this, and it means a lot to me. All right? Now I want to yield to Derek. We'll get to the recommendations in the end, because after listening to CMHA, you might want to amend some things to add or take away, because you'll hear them narrate to us.
Okay.
All right?
Thank you.
Derek?
Thank you, Chairman, to Rebecca and Councilman Starr and those at the committee at the table. I thank you for the opportunity to be here today. My story of lead poisoning started with my son, Demetrius, when he was a year and a half old, when we were in Lakeview Terrace. I learned of lead poisoning at his age of 9 years old. And that stunned me as to the behavior and his social skills. But I want to look further at the cognitiveness of the effects of lead.
Cognitive
And
behavior.
then their behavior, and then look at some recommendations from 2 and 3. When Demetrius was about 9 years old, we tested him for lead poisoning, and I filed a lawsuit against CMHA and Scattersite Housing to clean it up, class action suit. Subsequently, in 1995, with the Claire Freeman administration, I dropped it on the approval that they would go forth and clean up the lead. But subsequently, my son passed of lead poisoning complications. And I've never shown this before, but this is his autopsy report of what I've been speaking of for years. The fact that he died from 4 different ailments, which the medical
Is it
examiner...
okay that
Yes.
other council members can
Yes.
see it as well, Derek?
Yes, I brought it for them to read it.
And then
And
she could make copies and give it to us while you move forward.
and I outlined the four physical ailments that he had. Diabetes, liver disease, kidney disease, and heart disease, all coming from
Lead.
the complications of lead. And one of the,
Muchas gracias.
so, and the coroner listed that my son died from a liver of a man that drank wine for 50 years. And he was 80 years old. That was the condition of his liver. So I know that also lead goes into the soft tissue of the organs. And once it's in there, it stays there for 35 years. So you may not be able to see the lead poisoning effects at that time, especially since it only takes 30 to 35 days to move from the bloodstream and into the soft tissue, into the bone marrow of the body. And it doesn't come back out of the bone marrow unless there is a deficiency in calcium and iron. So we don't know what organs will be affected in each and every child. It may be diabetes, it may be a heart condition, it may be liver, but lead is a disguised killer. So we recommend in number 2 that we have third parties to go into CMHA and to train the residents, to set up resident training so that they can identify and understand the problems in the units with lead to allow the management to know. And then the third issue that we're looking at in the recommendation is that we train the employees as well as the management to go in and to be able to observe conditions of lead poisoning. And we as CLASH, we will be willing to work with CMHA to implement those programs to educate.
What I mentioned to you last week, and I reached out to Patterson, Director Patterson, Jeffrey Patterson. He said he was okay, there's no pushback, and I said I need Councilmember Starr to work with you guys on that. So when he does his review, Jeffrey Patterson is in there with the Tenants Council. And so Jeffrey Patterson, the president, he wants the residents to be trained.
Yes.
He told me over the phone he doesn't have any problem with CLASH, but he just doesn't know you guys, but he said it's okay with me. But I need Councilmember Richard Starr to be there as well so that he'll let me know. Starr calls me back at 4 a.m. in the morning or whatever, and he'll let me know what's going on. That's true, isn't that right, Starr? He talk with me about it. So we're there. We just have to put it together, find out when Councilmember Starr is available, you're available, Derek, and then with Patterson, and then we'll move forward with that.
The EPA.
And the EPA.
And also the EPA.
Yes. You want EPA?
The U.S. EPA will be involved.
Okay, cool. I'll talk with David Margolius, the director, and we'll make sure that happens as well. We'll write it down. We'll meet. We'll meet over there at CMHA because they know. So, will you finish with that? Because I want to get to Spencer
Yes,
and then bring up CMHA.
Yes.
So, we're passing this around now to everyone. Derek, is that cool, Beans?
Thank you. Yes.
Okay, sorry about your son, man. That's rough.
Demetrius represent every child that is poisoned with lead and is dealing with the consequences and living with the illnesses today. And we're now into the second generation of that. He would have been 41 years old. And there are many, many, many young adults that I talk to, and Spencer and I reach out to. And many of them are afraid to come forth to let the authorities know. Those residents do not want to call in CMHA to address the problem, for they're afraid of retaliation and being removed from their homes. So that is one of the issues that
You'll be okay. You have a good one with Councilmember Starr.
Yeah.
He'll be there. He advocates for his residents. I already mentioned to Jeffrey Patterson, I said, now, when Starr is there, it's not going to be, I got to tell you, with this young man, there's no in-between. He's going to be there to advocate when you guys sit back and meet, put things together. And this young man, he will meet with him afterwards, and because he really cares about his residents. And I mentioned that to Jeffrey Patterson over the phone. Jeffrey said, that's okay. He said, Starr's very passionate about his residents. He'll tell you, we talked about you when you went around, Councilmember Starr.
I hope you was telling some good stuff this time.
It was good. It was all good, man. We're passionate. So we're gonna be in there.
Okay.
And this guy, he's got a lot of energy, and we'll move it forward. So if there's any threats or anything like that, we'll know.
Okay.
And he has a up close view with the residents and a sensitive ear, so they all know him over there.
Yes.
So, because that's what they're gonna look to. They know people. Spencer, and then I'll bring up CMHA.
Yeah, I'm going to be real quick. My name's Spencer Wells. I'm the treasurer of Clash and been with the organization since the inception. I really wanted to address one issue that we've kicked around a lot and never resolved, and this would be a good opportunity to do some research. Clash believes that CMHA is covered by Cleveland city ordinances around residents first and the lead safe certificate.
They are.
ordinance. We believe they are.
They are.
And that therefore they should be coming into compliance with getting lead safe certificates, doing rental registration. And there's a lot of misinformation about that. When we do a neighborhood event, we'll be talking to people and they'll say, oh, no. We're in CMHA. They took care of all those problems. And that's the level of misunderstanding that's in the community. So in addition to education, we want to have a second set of eyes on the compliance, because the IG report says they were doing this audit of CMHA in part because they recognize that HUD has not been doing the oversight. If we can bring them under the control, the accountability to building and housing for compliance with the certificate law, that's another set of eyes that's going to be watching to see that they're following through and making homes lead safe without having to get an IG report or without having to start to bring cases to court. So we've done some legal research. We think this is covered. We'd welcome law department doing a legal brief, and we'd be glad to supply the information that we found, which clearly says that the HUD regulations, HUD-funded programs, and public housing authorities in particular are subject to local building, housing, health, and safety codes. And we can share that information.
Okay, great. When we meet, have you ever met Councilmember Starr?
Yes.
Okay.
We met in the basement, not in the basement, but in the community room where Derek lives over at Arbor
Don't
Park.
you? He's over there. He's over there. So what we'll do when this is over with, because I like outcome measures, I just don't want a hearing.
Yeah.
We'll huddle, we'll meet, we'll get a date, we'll put systems in place, so the residents will be educated, put more eyes and ears. I don't mean educated in a bad way. You could train them so that way that they know what's going on. And if we need to bring in building and housing, then Councilmember Starr will help to champion that as well. And then we could bring in building and housing. Because we want-
Mr. Chairman, I want to reiterate what Ms. Hall said earlier, is that we have a really good working relationship with the US EPA. And one of the things that they've done for us is they have a curriculum. It's about 45 minutes. It's called Understanding Lead. And we've provided forums for them to come in and do that presentation. And it is a real eye-opener. And I've been working on lead issues for about 20 years, on and off. And I learned things from sitting through their presentation. So we'd like to be able to bring EPA's resources in as well as the resources in the local community.
Well, you know what? Let's, Spencer, I have to talk with Councilmember Starr. He puts on events. It would be great to have EPA to have an event at CMHA with the residents there. I will attend, and I'm sure that the committee will attend also, but we'll, it's in his ward. That's why I mentioned Councilmember Starr a lot. We can have it there.
Well,
And then we can bring the residents so that way they'll see what's going on as well.
Councilman Chairman, I would recommend that we do it at every building. And we do it at times when people can attend, so that we don't have to wait for people to come to us. I think our whole methodology of doing outreach and education is we go to where we find people.
The mountain won't come to Muhammad.
Yep.
Yeah.
And the EPA is more than willing to come to all of the sites that we
Wow.
have. So we work with them very closely, and I'm part of the National Environmental Justice Advisory Council for the EPA. And so we have an opportunity here to make sure that our residents understand what they're dealing with, and also the workers, because just understand that children can be poisoned, but so can adults. And then the thing is, it's the work that they're doing. If they actually start scraping walls and doing other things, and it ends up on their person, on their clothes, going home to their children and taking it back home to their children, is something that could also happen. And so that's one of the reasons why I talked about all of the things that happen with lead poisoning, because I really don't think we understand the gravity of this issue. This is something that impacts people over a lifetime. We are seeing all of the social and structural determinants of health in the city of Cleveland as a direct result of all of the lead poisoning that we have in the city.
Well, you know, I'm going to yield to CMHA real quick. I think it was in March, Councilman Starr. We went to HUD. We visited HUD.
Yes.
So we have no problem going down there to HUD, and we went through the administration, and we discussed our issues and concerns. Because, I mean, you set the meeting up, right?
Yeah,
What was it, on Thursday or Friday?
we went there on a Thursday, when we was at a conference, and we was able to ditch out of the conference to get in contact, because some of the things that I questioned was, how things are doing and how HUD operates. And if you look at most of the properties in my ward that I represent, we have a lot of people living in public housing assistance. And one of the questions I wanted to make sure is get an understanding of what type of development is coming, what type of grants is available. But then also I asked a question about lead because I had some different questions I had third quarter of last year about lead in these properties. So I said, hey, I'm not being able to get directed into the right questions asked. So when we went to DC, I went to HUD. Then I wanted to find out who's the point of contact, because outside of lead, I've been dealing with property maintenance issues, landlords who's just been treating residents unfair, and then obviously with the time that I met with Mr. Wade for about the last year and a half, we've had conversations about lead, and he was informing and educating me on things that I was not really up to speed on, which made me want to do more research, and now I think I'm really understanding now.
See, we have no problem with going to HUD. If we have to fly there to go visit the administration, if CMHA is not doing what's right, when you guys do pre and post testing, we'll go there.
So we have HUD, which is our Housing and Urban Development, but also the Environmental Protection Agency. So that's the agency that we work closely with. But, you know, because HUD is what brought this to the table, but the EPA does the trainings all across the country. And so it's important for us to use what they already have in place, what they're willing to do in our region. And because this is Region 5, and so Region 5, you know, does have a large number of communities that are impacted by lead. It just so happens that ours happens to be one of the #1 communities that's impacted in Region 5. And so the EPA wants to make sure that they're boots on the ground, helping out in any way that we can possible. And we've been doing some resource fairs with them. And so them coming into all of the units and educating the community is something that's vitally important to the community members and to the council and to the city for the efforts that they're willing to put in for our communities.
Got it. So, saying that, I'm going to bring up CMHA. Rebecca, you're going to be with Star. You know, you wrote a lot of the radical papers. So we'll move forward with it. Derek, when you and Star get together, make the phone calls, put systems in place. I'll be there. I just got to jet out for a little while, for a minute. I should be back on the 6th of August. But don't wait for me. And we'll move forward because this is a sense of urgency. And we'll put things in place. And then we'll go talk with CMHA also so that we're there.
Okay.
Chairman,
all right.
can we also make sure that we are not only addressing the education component, but that testing component, testing every single child in every single unit is going to be vitally important to this program?
Write the scope down when you guys meet. Put the scope, and then we'll move forward. You know, you and I, we talk. This is important for me. I want to say this, when, and I always, that's what's my buddy over here. When Councilman Starr alerted me to this, I was walking in my house. He's blowing the phone up in my ear, and I hadn't read it yet. And I sat down on my couch. Remember I called you? And I read the report, and my eyes went red. Because who is going to look out for the children? Who's going to protect the children? And I saw that, this report, CMHA, then I called David Margolius, called Starback. I talked with Yvonne, the wife. She said, call the hearing now, Derek, call the hearing now. Because, you know, when you're dealing with the children, this was, it almost was in tears. So we'll move forward. This is a sense of urgency. I'm there 100%. You know that. I need to call CMHA out.
Okay.
Thank you.
Thank
Well,
you.
Thank you, Dr. Margolius. But stay around, because these recommendations that you gave me, you might have to amend some of them once you hear the presentation. You might have to add or take away or whatever. Director, David? Building the housing here and community development. So let's move forward. Who's narrating the presentation?
I'm going to, Chairman, I'm going to open it. I'm going to have my Chief of Staff and Special Assistant to the Special Counsel of the CEO is going to go through the presentation.
Okay, you're going to introduce everyone that's from CMHA. We already know Dr. David Margolius and Director of Building and Housing, as well as Director of Community Development.
All right. Good morning. With me this morning, I have Mr. Jeffrey Wade. He is our Chief of Staff and Special Counsel to the CEO, and Mr. Terry Billups, who is our General Counsel for CMHA. First, I want to thank City Council leadership and the members for providing CMHA an opportunity to discuss one of the most sensitive issues housing authorities consistently face across the country. That is, how do we provide the best housing environment for our residents while combating health risk hazards in a challenging time without adequate resources to address the overwhelming need? Providing a safe, secure, suitable, accessible, healthy housing environment is critical to helping our families, seniors, disabled persons, and other vulnerable populations live with dignity and respect. Environmental and health hazards posed by lead-based paint threaten the ability of housing providers to create safe spaces for our residents and others to enhance and improve the quality of life for the people that we serve. On June 14, 2018, the HUD Inspector General issued a report entitled HUD's Oversight of the Lead-Based Program in Public Housing and a Housing Choice Voucher Program. As you already discussed, this report stated that there were things that needed to be done as it relates to the oversight by HUD. On June 12, 2024, HUD issued a report, the HUD Office of Inspector General issued a report regarding its review of CMHA. The audit focused on CMHA's management of the lead-based paint in its public housing based on the IG's assessment of risk of lead-based paint in public housing. The risk assessment factors included the age of the buildings, the number of units, the household demographics, and reported causes of childhood lead poisoning. The OIG review generally covered the period of January 1st, 2020 through December 31st, 2022, but was expanded as necessary. Let me say clearly, we take these, we very seriously take the IG's report and their belief that there has not been adequate oversight of the lead-based program in our homes. While the IG's review and assessment of CMHA's oversight in lead-based paint in our homes may not in some areas accurately reflect the facts regarding CMHA's effort to control and eliminate lead-based paint in our properties, it is clear that we can and we must do better in this area as we move forward. We agree that there are certainly opportunities for growth, improvement, and a more focused collaborative approach to addressing those remaining properties with units that have lead-based paint. While we still must work with HUD to develop a formal response to the IG's report, we have begun to identify a few areas of focus. In doing so, we are committed to working with our partners to achieve the following goals for our children. First, we want to strengthen lead-based paint control efforts. While we know that there are things that we're doing on the construction development side, we want to make sure that we look at our processes, we look at our procedures, and we look at what we can do to be able to manage lead in a much more appropriate manner. CMHA has resumed full annual inspections. CMHA has automated the linking of our units' specific lead disclosures to lease documentation in our system of record. During our prepare for occupancy process and make ready process, CMHA goes in and makes full repairs of the unit and examines what needs to be done. A second area that we want to identify is eliminating and modernizing pre-1978 buildings that contain lead-based paint. This is our long-term strategy. The only true definitive approach to working to eradicate lead-based paint in our units is not just vacating the units, but demolishing those units and building housing that does not contain lead. Over the years, CMHA has demolished over probably close to 3,000 units of housing, which has led to redevelopment of various new housing opportunities across the city of Cleveland. Examples include Valley View Homes, now Tremont Point, Cedar Extension, now Sankofa Village. We also have done work at Carver Park, work at King Kennedy, and work at Riverside Park. Most recently, in partnership with the City of Cleveland through a Choice Neighborhood grant received from HUD, we vacated Wood Hill Estates and began a demolition on a new development that will provide both on and off-site affordable housing opportunities within the Buckeye Woodland community. The first phase, Wood Hill Station, is completed. The second phase, Wood Hill Station North, will be completed this week. And the third phase, Wood Hill Station East, which is also in the area of 93rd and Buckeye, is actually closing as we speak. From that point, we'll continue to do work on that site to redevelop that as well. We're also going to work to demand accuracy and transparency. We will review and develop updated lead-based policies and procedures. In doing so, we must identify areas where we can and need to do more in disclosing lead-based paint to residents, testing these units, and providing proper notification and follow-up with the affected families, HUD, as well as the Department of Health. We want to work on building capacity through partnerships. We will strengthen our capacity by forging partnerships with federal, state, and local agencies, as well as resident organizations. Their support is critical to us achieving these goals. CMHA will collaborate with the City of Cleveland, our resident leadership, and other organizations to enhance our lead-based training programs. This will include training for the CMHA Board of Commissioners, the CMHA Executive and Senior Management Team, and extended awareness training for on-site management, maintenance, and administrative personnel, more specialized training in risk assessment and inspections, and general lead-based awareness training for all CMHA employees. We will also collaborate with the resident leadership and other organizations to educate our families on all of the effects of properties about lead-based paint, and a more intense focus on sites that house children. We will provide information that helps answer questions such as, what is lead-based paint? Why is it harmful? Whom does it affect? Is there anything that can be done to get rid of lead? Will I have to move? What can I do in the meantime? Today, as requested, representatives from CMHA will review each of the findings in the report. The team will address the IG's review areas and provide facts about what CMHA has done before and after report, and the next steps needed to address the concerns of the IG, HUD, and most importantly, our residents. While portions of this presentation may be a bit technical, it is important to note that we all understand that there are people that are involved and lives that are involved. And we want to do whatever we can to try to work through this as much as we can. This is not just a CMHA problem. This is a problem that's nationwide, and we want to work with all of you as well as the organizations to move forward in this area. So at this time, I'd like to turn it over to Mr. Wade, and he will kind of walk through the IG report. Thank you.
Wade?
Good morning, Chairman. Good morning, members of the committee.
Let me ask my committee, I know you read this already. Have you read the IG report yet? Any other, Council Lady, did you read it? You read it?
Trust me, yeah.
You marked it all up?
Too many marks, yeah.
Okay, we'll move forward. Thank you. We can listen.
My role this morning is to overview the report itself, to speak about not only the findings of the Inspector General, but also to point out the processes that the authority has. The authority has had these processes for many years. That this report, while it looked at the period of 2020 to 2022, that many of these protocols and processes have existed for decades. So at the outset, this report reviewed the period of January 1st of 2020 through December 31st of 2022. The report during this period identified 14 instances of elevated blood lead levels in children. Of those, there were 10 that were confirmed, meaning that either through the city's Department of Public Health or through engagement with those families, through the medical records that the family would share with our risk assessor, that those cases were found to be confirmed. There were 4 during the period of the audit that could not be confirmed because the documentation was not made available to the authority. Since the time of the audit, there was 1 additional case that has been confirmed, and that was recently through the Department of Public Health. In the instances of those cases that have been confirmed, there were 5 that were actually managed through the Department of Public Health. The Department of Public Health would, of course, follow their protocols, their processes. It's important to note that in those 5 instances that the CDPH carried out their on-site inspection protocols. They did their risk assessment. Those assessments found that there were no lead-based pain hazards in those units, and those cases were resolved. In the remaining 5, our risk assessor completed the process that we follow, and that's a process that is overviewing the bricks that are displayed on the screens before you, which is essentially a process of engagement, of assessment, of work, and then control. So the risk assessor will begin in response to any report of an elevated blood level in a child. The assessor will engage with the family, attempt to speak with them, if at all possible, within 24 to 48 hours. The assessor will view what's known about the conditions of the unit, meaning she will look at the history of the unit, the inspection reports, she will look at the lead-based peat disclosure, then she goes to the site. She's then visualizing the conditions in the unit, observing that, conducting the interview with the family, completing the questionnaire. That's important to understand what's occurring with the family, what are their circumstances, together with what are the circumstances of that unit. She will then, if there are conditions in the unit that require work, she will cause those work orders to be created. It goes to our painting team. All members of our painting team are certified for lead renovation, repair, and painting, so that they know that I believe that the statement from Clash a moment ago was that, you don't just go ahead and start sanding the wall. They know that they're not to do that. The work that occurs in response to these assessments is carried out without the family present so that the interim controls can be established and maintained. Once the painting is finished, the risk assessor comes back and she ensures that that unit is cleared by taking the needed dust samples, establishing and maintaining the chain of custody, sending it to a lab, getting those results back, and clearing the unit. The UIG report, as Mr. Patterson alluded to, doesn't come in a vacuum. We know that the Department of Housing and Urban Development itself was the subject of an audit by the IG in 2018. So we know that there were a number of findings that the IG made with respect to the department itself. That does not then excuse or in any way justify any findings that were made with respect to CMHA, just that this is a national issue. I also want to make the point at this moment that once again, despite any technical findings in this report, that the substantive protocol that I described a moment ago has, was, and will continue, that process has and will continue. The deficiency that the IG identified was not one of substance, it was one of form, meaning that the summary report, which they refer to as an environmental investigation, was not a document that we formally included in our files. That changed in about April of last year, following a conversation with the IG on this point. The next is that this topic of reporting to HUD. The IG noted, and it was corroborated in the document itself, that the reporting to HUD of the cases that CMHA is aware of was resolved beginning with January of 2023. So for the last 19 months, CMHA has reported these instances, and HUD is receiving those reports. Also like to take a moment and just express our appreciation to Director Margolius and his staff. We have a deep relationship with CDPH. Our risk assessor has greater than 24 years of experience, half of which was with the city's Department of Public Health.
You told me.
So that we have those deep connections, and we're also able to call each other to be able to work through these issues. As Mr. Patterson expressed in his opening remarks, there are 4 specific strategies that we're pursuing in response to this report. The first is that we're going to strengthen and continue to enhance all of our controls around how we deal with lead-based paint in our homes. The next is one that Mr. Patterson, as well as our board, share a great passion and commitment to, which is the elimination through demolition or through modernization of those homes that still contain lead-based paint. And I'll come back to that point in a moment. The next is the need to continue to demand and expect accuracy and transparency, and to continue to do this through the partnerships that we have today, as well as those that we need to establish and facilitate. I think there are lead-based paint controls. The one is that this is a direct correlation to our inspection process. While it's not an excuse, we all know that during the period of 2020 to 2022, we were dealing with a worldwide pandemic. Most of the inspections that the Housing Authority would typically carry out were suspended for the reason that we were minimizing contact with families to avoid the spread of COVID-19. While the IG specifically observed that the 12-month period of visualizing the conditions in the unit was one that HUD did not waive, it still does not account for the fact that we were not going into homes, but for those that needed an emergency repair. Beginning in the fall of 2022, those inspection cycles resumed. One of the, I think, improvements on that process is that we now have, during this period, we have a new system of record which allows us to do things in the present that we could not do in the past. One of which is to correlate the findings of an inspector directly to a work order in our system so that we can then act on it and ensure that those conditions are resolved. The second is that we are establishing what we call cycle painting, meaning that we know that whether it's a period of 3 years or 5 years, whatever those cycles will be, that we will be back in units and painting those surfaces. Because while we all know that lead is ubiquitous in the environment, we have to control for lead that's contained in specific components in our housing. The only way to do that is to ensure that that painted surface is intact, and that's what this accomplishes. The next responds to the IG finding that there were instances that the disclosures, which are the documents that are presented at the time of leasing that describe the conditions in the unit, to the family that's going to lease the unit on what that is, that in the period of the audit, there were instances where the disclosure wasn't in the file, it was not signed, or there was information that was lacking in the disclosure. We have now taken the step to link those disclosures directly to our units so that at the point of leasing, the family receives the disclosure that correlates directly to that unit. It's printed as part of the leasing packet. There's no opportunity for discretion for someone to say, I don't have it. It's printed right there for them to then review with the family. And then the last step in this is our what we call our make ready or our prepare for occupancy process. So far, year to date, we have made ready more than 425 units of housing. The importance of this is that as parts of that process, every unit is fully painted from door to door, ceiling to wall. Every surface of that unit that requires paint is painted so that we know that for 2024, we have at least these 400 units, that the painting is intact. Through this process, we also ensure that if a unit has lead-based paint, that our risk assessor is always the last step in that process. She's notified, hey, the work's done. Then she goes to that unit. She conducts her evaluation. She takes those dust wipes. She sends them to the lab. She clears the unit. If it does not clear, nothing happens until they make that unit clear and it's resolved. Then she'll release it for leasing. The next is, I think, one of the things that, again, that we're deeply committed to is the complete elimination of lead-based paint in our homes on painted surfaces. We have a deep history with this that dates back to the 1990s. As Mr. Patterson observed, there's more than 3,000 units of housing in this 25, 30-year period that have been completely demolished, that have now been rebuilt with beautiful, modern homes that do not contain lead-based paint. That's the goal. That's where we want to be. But that requires both time, funding, resources, and I'll speak to that again in a moment. Particularly at our large family estates such as Cedar Extension, Carver Park, Valley View, Garden Valley, Riverview, Riverside Park. These are all vast family estates that no longer contain lead-based paint. Whittle Homes, Mr. Patterson mentioned a moment ago, this is the first phase that's depicted in this slide. The two phases that have closed, the one that we are looking forward to hearing is closed today, will replace more than 487 units of housing that date back to 1940 in the Buckeye-Woodhill community. Those units are now completely vacant. If you've traveled along Woodland, you know that demolition has commenced. Buildings are coming down. This is a demonstration of the work that we're committed to long-term. Additional examples include our master planning processes for Althwaite homes, for Old Cedar, as well as Lakeview Terrace and Cedar, what we call now Sankofa Village. Cedar Extension, which I think is a remarkable example of CMHA's commitment to this work. in that this redevelopment really began back in 2011, and the final phase should close in September so that that site will be completely built out. This will, once all this work is complete, this is another 1,700 units of housing that will be completely modernized, and the lead-based paint will be removed. The next is that we are engaging in the same processes now for both our Wilson Tower, Wilson family projects, as well as at King Kennedy. And these processes will begin this fall. This will then address another 700 units of housing. We also were the recipients of a $5 million grant that is allowing us to remove lead-based paint from the common areas at Old Cedar. So the walk-up units all share a common stairwell. And in that stairwell, the stringers, the risers, the railings, from the date that these units were built back in the 1930s, contain lead-based paint. This grant is now facilitating the removal of all of those structural components, allowing us to rebuild those staircases so that as families both enter and leave their units, they can no longer carry lead dust from friction surfaces into their units.
That's a good thing. We discussed that.
The next is demanding accuracy and transparency. This goes to the IG's finding that I think to use their words, there was not sufficient documentation to support how CMHA characterized units as lead or no lead. We know that we have over 2,300 units of housing that are exempt from the rule. These are newly constructed homes since 1978 that do not contain lead-based paint. The next is we have...
But hold it there
Yes, sure.
real quick. They're exempt from the rules, but what if someone tracks something in there, or if a child or an adult, let's say they're contaminated soil or lead. Now, you mentioned earlier we're going to do some prevention on the other ones, but this one, the one you said exempt from the rule, we got to have systems in place so that people won't track in lead contaminated with their feet or whatever the case may be.
Ms. Hall alluded to this in her remarks, that we all know because of the industrial history of the city of Cleveland and the greater
Right.
Cleveland area, that we do have lead in soil.
Dry cleaners, gas stations, those things, et
Exactly,
cetera,
Chair.
et cetera.
So, the greatest control for that is intact grass, landscaping, as well as, we can, which we do at the point of redevelopment, you're going to excavate, you're going to bring clean soil in. But that doesn't address what you just raised. As families travel across the city, they may carry dust with them. The best control for that is to maintain the cleanliness of the common areas of the buildings, as well as the units themselves. And I think that the information that we're going to be sharing with the families to improve their awareness of how does lead come into the home. Because if it's not in the walls, if it's not in the ceiling, if it's not in the stairs, how can I be exposed to it?
Yes. You're right. You're
Yes.
right. Point.
To the point of that 2,300 homes with the exemptions, who exempt them?
That's a matter
chair.
of statute, I'm sorry, from the chair to the councilman, that by rule, those units are not subject to what's known as the lead-safe housing rule, because they do not contain lead-based paint.
To the chair, meaning who did the inspection to say that those do not have it? Is it something that the federal government just regulated and said they are exempt because of X, Y, Z? Do we have anything to determine, like, okay, these 2,300 units, they've been tested, they are exempted because of what? Because if you're saying they were built between 1978, we know prior to 1978, lead was used in the paint that was provided, that we use in these homes. And now I'm trying to get to understanding what you mean by 2,300 now are exempt. Who exempt them? To the chair.
From the chair to the councilman. So these are homes that were built after lead-based paint was prohibited. Lead-based paint was not available to use to paint these homes. These are homes that were constructed in the early 2000s, in the middle decade, as well as that were built just within the last 3 to 4 years.
Thank you for that clarification.
And you know what, Jeffrey, put some kind of prevention measures in place. Although we know they were exempt, CMHA must lead the way. You know, we're putting lead in throughout the city, how we deal with lead. You guys can lead the way. And although it's exempt, we need to put some kind of systems in place to do prevention. Because it's still, as we mentioned earlier, this was an industrial city. You can track things in. You had a dry cleaners. It was raised, demolition. The soil may be contaminated. Some child to and from school, track it into the house. Some kind of systems must be put in place and not just go by saying it's exempt because the federal government, whoever says it's exempt, you got to lead the way and you got to champion it.
Mr. Chairman, you're exactly right. We don't have a problem with that. I think that as all of us get a better understanding of lead, what the effects are, where it's coming from, the threshold, one of the key things was eliminating the housing in itself. The second part is, okay, so you may have eliminated this housing, but there's still housing all around.
Right.
And individuals go from place to place.
Yes.
So what things can you put in place to try to make sure that the housing, that we're on the same page there.
Got it.
And we look forward to those conversations with the appropriate parties.
Yeah, because when you do your risk analysis, you look at risk internally as well as externally. So what Jeffrey just narrated, you got to look at those risks, and you can't sit back to say that this right here was exempt, so therefore we're not going to look at it. So when you look at the critical path, it still could be affected. And if one child is hurt, the entire community as well as the city is hurt. And that's what we're here for right now. You got to do prevention. Prevention is the key, and especially if you keep mentioning risk. In your risk analysis, prevention is in there, and you know it is.
Understood.
Are you? Continue.
Thank you, Chairman. The 4,500 units that were on the screen just a moment ago is sort of the focus of what the IG criticized or found, that from their perspective, there was not sufficient documentation for our characterization of those units as not containing lead-based paint. Just to make the observation that many of these documents are over 30 years old, that we provided to them voluminous information, but we are committed to re-inspecting those units of housing, to retesting them, to validate, so that we can demonstrate that we're both accurate and we're transparent to every family who resides in those units.
So when you do your progress review, Mr. President, Director, do you guys discuss lead also? How often do you do that? Do you look at it?
We discuss it within our own ranks. I think one of the things that we're going to be doing both to our board as well as in partnership with the city is to have some level of quarterly meetings where we discuss what our progress is and elevate this to a level where we all are monitoring and engaging, looking at the trainings that we're talking about. Because that fourth bullet, the building capacity, is fourth, but it's so key. It's providing that education, it's providing that information, it's letting people know what's going on and giving people the tools to be able to say, hey, look, I know from this class that this is something, I need to tell you about it,
Yes.
and then someone needs to do something about it. So that's where we are. We're going to elevate that to a different level and making sure that we are monitoring it, and from quarter to quarter, year to year, we could see our progress and we could see what we're doing, much in the way that Mr. Jeff Wade illustrated the progress that we made as it relates to the redevelopment of different organizations, of different sites. But the subcategory of that is, okay, so now that you have these sites, new sites there, how do you make sure that you are taking steps to still make sure people are aware of what's going on, but also that there's a sensitivity to them coming from other areas where they may have previously had some exposure.
So when you put together your training, Mr. Wade, training is ongoing.
It is.
A lot of times people would train someone and say, well, they have training in January, and then they might miss it in April or whatever the case may be. But when you train someone, it just got to be continuously training to make them experts. It's ongoing. It's just ongoing, constantly training. Now, Derek Wade just mentioned, and I've been knowing you forever and ever, Jeffrey Patterson. He says some of the residents are afraid to report, and that's not in your behavior. It's just not, because I actually know you, and they can report to you guys without retaliation.
Right, and I think what we're looking at as part of a process is to find a way of a non-CMHA individual that can help kind of be like a navigator, an assistant to helping to, transition that information to us so that we can assist. We have resident services staff that aren't a part of housing management that currently work with our tenants. We want to expand that and maybe even look at some other partners to kind of help people be able to share that information. The housing is so precious. People don't want to sometimes do something that they may perceive may get them in trouble. But for something like this is not about trouble. This is about being right, about being safe,
right,
and trying to make sure that people are healthy. So we want to set some things up like that to make sure that people can communicate that to us effectively.
Yeah, you narrated that to me when I talked with you over the phone. I have some questions when you finish, but I'm going to yield to my colleagues, because you and I, we talk all the time anyway, and I can call you, and I don't want to be redundant. So
But just, Mr. Chairman, if I could
Yes.
say one thing to close
Yes,
this
yes.
presentation out. Again, we thank you all for giving us the opportunity to come here and share this information and hopefully be able to continue to develop some different partnerships. The one area that we have not discussed in any detail is as it relates to the housing choice voucher. We are going to be partnering with the city of Cleveland to look at how we can use that, a possible MOU to look at how we can create some guidelines and things like that as it relates to letting sharing information for units that are covered under the Housing Choice Voucher Program. So that's something that we've had some brief discussions about, but we want to forward some work in that area as well.
Okay.
Thank you.
And I will visit you next week when I get back. I'll visit you.
Looking forward to it.
Cause Councilmember Starr, and we'll come over, we'll come out, just show me some things.
Sounds good.
Will you finish?
Yes, sure. Thank you.
Are you going to narrate?
No.
Okay, Council Lady, to the Vice Chair first, and then I'll yield to you second, Mr. Starr.
Thank you, Councilman. Thank you, Chair. Thank you to CMHA and the departments who are sitting with us at the table today. We've started with a bit of narration, and so I'm going to start with a bit of narration too, and then get into a couple of questions, particularly related to the elevated blood lead level cases. The first thing I want to start with is that I think this report was such a raw moment for so many of us who have worked in lead over the years, because it opens a wound. It opens this wound that has been festering in this city for decades. You can go back to 1967, to Martin Luther King talking at town halls in Huff, where residents were complaining about lead-based paint and not feeling like they were being heard or being taken seriously. And for generations, for decades, we've gone through cycles where this city has said, we're going to deal with lead. Our children matter. We are going to get this done. And then it doesn't happen. And we've been through that cycle so many times. I stepped into it really at the point of the Toxic Neglect series in 2015, which the Plain Dealer wrote, talking about mismanagement of elevated blood lead level cases. And I want to acknowledge, because we have the Director of Public Health here today, how far the department has come from the time of that series. I don't want anyone to think that what is happening or that this report speaks to those levels of systemic issues. We've fixed problems, and then it comes up again, and it comes up again. And when this report was released, it cracked that wound wide open. And that's why it hit at so many of us. And in particular for families. You know, you're raising a young kid, you're already sleep deprived and trying to get childcare, which is unaffordable, and trying to keep food on the table, and you're not paying attention about the difference between lead at CMHA and lead in water pipes and lead in chocolate and food and toys, and you are just worried about this. And when you see a headline of a report that says, the Cuyahoga Metropolitan Housing Authority did not have adequate oversight of lead-based paint in its public housing, it makes you think, who's doing anything about this? Who cares? And I realize that that doesn't fall all on you, you know, that you are trying to, you have articulated ways in which this is part of a nationwide problem. You're articulating ways in which you fixed it since this report came out. I'm going to get into ways in which I think you need to take more accountability than what I've heard today already.
Thank
but
you.
I want to be honest that the level of frustration and anxiety and fear that you have heard in response to this is not just about the scope of this report. It is about decades of mismanagement on this issue. And for all of us at this table, on both sides, we feel the weight of it. Every single one of these children that test positive for elevated blood lead levels, God, I hope none of them passes away like Demetrius Wade. But we won't know whether it impacts their ability to succeed at school. We won't know whether it is one of those reasons that they ended up involved with the criminal justice system. For any one kid, we're just never going to know.
Never know.
But across our whole society, what we know is that this is impacting our city. And what we know is that on a generational level, we are not going to succeed and thrive as a city unless our children all have the chance to rise to their potential. And that's not going to happen when we have children who are being poisoned by lead in our city. And I want to be clear, because this isn't, we're talking about this at a nationwide level, but Cleveland has a unique problem here. When we look at the numbers out of Detroit, Pittsburgh, Buffalo, cities that have very comparable housing stocks, comparable histories, you know, the Rust Belt, okay, our elevated blood lead level cases are still higher. They are still higher. They are higher than they were in Flint, Michigan at the height of their crisis. And so when we get a report like this, okay, it's about 10 cases and the management of your properties across the board, that is, frankly, a slice of the pie. It's only a slice of the pie, and we have to deal with the rest of it. And so I want to acknowledge that while we dig into this slice of the pie today, all of us at the table are committed to dealing with the whole problem.
Right.
And it's a weight that's going to sit on all of us. I hope I do not work on this for my entire career, but I expect to be working on this for my entire career. I appreciate that chance to give you a bit of background about the question, about why I'm digging into this, why I'm asking the questions. But I really want to turn to a particular aspect of this report and dig into it. If you could bring up slide 3 of what you presented here, this breakdown of this one. The breakdown of the elevated blood lead level cases. I hear you when you say that aspects of this report were about what you say is form and not substance. I don't think that was all of this report. I don't think that everything that was talked about here can be whisked away as talking about serial numbers on XRF guns and stuff like that. There were real concrete issues in this report that I want to air out and really make sure that the public understands and that we all understand. And the main one comes from this slide, which are the 10 confirmed cases of elevated blood lead levels that had to be processed through arguably both the Cleveland Department of Public Health and HUD's guidelines. So I want to start by just reiterating some facts and really saying them again for the public. So first, to the public, there is no safe level of lead in a child's blood. But we do measure how high the level of lead is in a child's blood, because that's an important measurement of how bad things can get. Underneath, now we're moving towards a standard where 3.5 micrograms per deciliter, that's that phrase MCG over DCL, micrograms per deciliter, is the standard where we begin to take action. Okay, even below that, it's not good, but 3.5 is where we start to do things. But for a long time, it was 5. But either way, between 5 and 10, 3.5 and 10, what's supposed to happen is, for a non-CMHA property, the Cleveland Department of Public Health reaches out to the family and informs them of information about lead poisoning. But there is no on-site inspection for non-CMHA properties. I'm through the chair to the director. Am I accurately conveying that?
Through the chair, that's correct.
But on CMHA properties, it's a little different. Even below 5 micrograms per deciliter, I apologize, even below 10 micrograms per deciliter, CMHA is supposed to go through the HUD lead-based paint protocol that you outlined in the subsequent slides. Is that correct, Director Patterson?
Mr. Chairman, I'll defer that to Mr. Wade.
To the chair, to the vice chair, that's correct.
Thank you. Above 10 micrograms per deciliter, there are 2 inspections that are supposed to happen. Both CMHA's inspector is supposed to be on site, and the Cleveland Department of Public Health is supposed to conduct an on-site inspection. Is that correct to both Mr. Wade and to Director Margolius?
To the chair, that's correct.
Through the chair, yes.
Thank you very much. So what happens after one of these inspections, particularly CMHA one or the Cleveland Department of Public Health, is that if they find evidence of an active lead hazard on the property, which might look like deteriorated paint, they write up a report. For the Cleveland Department of Public Health, it's called a lead hazard control order. I don't know the name of your protocol, but I assume there's a similar language for your lead risk assessors denoting the lead hazards on the property and laying out the protocols for what happens after that. Is that correct, Mr. Wade?
To the chair, that actually is the focus of one of the findings to the IG report. So the substance of the response to the case was performed, but that formal report was the element that we lacked prior to April of 2023.
And through the chair, if just on the role of the Cleveland Department of Public Health as the local delegated authority of the Ohio Department of Health lead program, our inspection takes place within a few days of notification of that elevated level of the greater than 10 micrograms per deciliter. And it's very comprehensive, including the use of an XRF gun, of dust tests, of soil tests, if applicable, throughout the home and the residence. And in each of those cases, we didn't find any evidence of lead paint dust. We did not.
Thank you, Director. I do appreciate that. That does require you to have access to the property, correct? Through the chair.
Through the chair, we are given by law that delegated authority access to the property. In rare cases, we are not given access, and we take those folks to court and to prosecution, but that has not been the case with CMHA properties. We're always granted access when requested.
Thank you. I was going to circle back to this later, but I guess I'd really like to understand then what happened. At the bottom of the IG's report, at the bottom of page 8, it says, according to the authority, the Public Health Department attempted to complete the environmental investigation but could not access the unit until after the affected family permanently vacated it. Despite the authority having access to the unit, it did not complete an environmental investigation as required. So your indication is that you did not complete the report during the typical window, but instead after the family had vacated. Through the chair.
Through the chair, that's the audit finding from the Office of Inspector General, but I'm not sure to what extent they accessed our records to make that determination. And so without knowing the specifics of the case, I just know that we're audited heavily by the Ohio Department of Health, and we've done our duty as the delegated authority to investigate cases of greater than 10 micrograms per deciliter of lead poisoning.
Yeah, absolutely. But I just want to make a point that there are occasions of above 10 micrograms a deciliter that you're not able to physically access the property, and some of your above 10 micrograms a deciliter cases are closed without access to the property.
Through the chair, there are multiple ways to close a case through our duty, and one of them is no contact. In order to close a case as no contact, we need to have a series of documented phone calls, text messages, certified letters. We need to reach out to the healthcare provider. We need to reach out to WIC, to any other agency, essentially, that we have access to or can reach out to be able to prove that no contact has taken place. So it is rare in those cases, and from my understanding, has not been the case with the CMHA properties that I'm familiar with.
Thank you. So you can confirm that of the 5 examples of more than 10 micrograms a deciliter, we did complete a full lead risk assessment of the property?
Through the chair, that's my understanding.
Great. Then I'll return to CMHA because what I want to highlight is the allegations in this report that painting was conducted prior to the environmental investigations. So through the chair, do you acknowledge that this report found that in 5 cases, the Cleveland Metropolitan Housing Authority painted over the units before the environmental investigations were completed?
Through the chair, that is the finding of the report.
Of the report?
Through the chair, excuse me, I characterize it by saying that the substantive work to keep the units safe, to make any deteriorated painted surfaces intact, that work was done. The fact that there was not a formalized environmental investigative report was lacking from the file. That was corrected from April 2023 going forward. But the substantive elements of the risk assessment, of the evaluation, the engagement with the family, all of that took place. The IG, while it was not documented in their formalized report, it was acknowledged by them during the course of the audit, but there were aspects of what we may have desired to be expressed in the report that the IG found that in the final version they did not contain.
Thank you. This actually helps me put a fine point on the question I asked earlier. I didn't quite understand your response, and now I think it's clicking in for me. So your interpretation of this report is that when the IG says that 5 properties were painted over prior to an environmental investigation, your response to that is actually that in substance, everything that an environmental investigation entails took place, but just no report was generated. Is that correct, through the chair?
Yes or no?
From the chair, that's correct.
And through the chair, how do you determine that this substance of a report took place? Because the point of one of these environmental investigations is to create the standard by which you then clear the property afterwards. If you don't have a report indicating how and what should be painted, you don't know what to clear. So are you indicating that there were also clearances that took place on these sort of invisible reports, through the chair?
Through the chair, what I'm saying is that once again, every aspect of the process was complete. So the certified risk assessor did every element of the process that was required. The aspect that was not done was a cumulative formalized report that expressed, I did this, I did this, I did this. The IG acknowledged that our files contain the elements of each of those aspects, but not a cumulative environmental investigation summarized in a formal report.
Did they include a clearance exam, through the chair?
Through the chair, each of those cases, yes, those units have clearances.
And did those clearances indicate the purpose and the potential hazards of what was painted over, through the chair?
Through the chair, those reports have, from memory, have the locations of which the samples are taken, the fact that the risk assessor has custody of the samples, the chain of custody, the transmittal to the lab, the return of those samples from the lab.
I don't understand how the report, the IG's report, indicates that the painting over was done before an environmental review, before the environmental investigation took place, and you are saying, in fact, the opposite, that an environmental investigation did take place, and then the properties were painted over. Can you help me understand where the IG got this wrong?
So, through the chair, the best way that I can characterize it is that, in my experience with auditors of all types, that they're looking for very specific itemized documents in the manner in which they're accustomed to seeing them and in the order in which they're accustomed to. The fact that you provide substantively every aspect of that does not then affect their determination or change their determination that the formalized report is not present in those records.
And so through the chair, when you say the formal report isn't there, I don't understand. Are you saying a lead risk assessor was on site and determined the locations for repainting prior to this repainting taking place?
Through the chair, that's correct.
Okay, and so through the chair, I want to make sure I understand in particular, were any of those cases of repainting at a case where there was over a 10 micrograms per deciliter where CDPH would have been on site as well?
Through the chair, no.
They were all at under 5 micrograms a deciliter.
That's correct.
So there's a complete...
No, pardon me. Through the chair, it would have been anything less than a 10, because at a 10 or above, CDPH is involved. And if I could clarify that even further, it's not that CDPH is not engaged, because at any level that comes through CDPH, they're of course engaged with the family, they'll exchange correspondence with us, we'll speak with them, but at the point of 10 and above, the process that the director described is followed.
And so through the chair, you feel very confident saying that none of the instances of repainting prior to environmental investigations took place in properties which CDPH separately had to complete investigations on?
Through the chair, absolutely.
Thank you. I will yield for now, but I want to make sure that my colleagues have the time to get into some of the other elements of this report, but I may come back with additional questions.
We'll circle back around to you, Madam Vice Chair. That was some good questions.
Anytime.
You know, after August the 7th, we're going to, matter of fact, I'll reach out to you later on today, Dr. David Margolius and Councilmember Richard Starr and my partner over here. We're going to visit CMHA, and we want to talk with you first before we head over there. And then bring out your instruments also, your risk assessments and the things that you're narrating right now, so that we can see it and understand it better also, on how you are doing evaluations. Because you could tell me at the table, but if I don't see what you're talking about, that's not good for me. So just bring that out also, the evaluation process, how you evaluate what the council lady just got finished asking you questions about. Okay?
Yes.
Councilmember Richard Starr.
Thank you, Chairman. Conwell, as well as CMHA for coming to the table. Thank you, Dr. CEO Patterson, just for your transparency and always having conversations offline and talking. We know this is a tough subject to address in the city of Cleveland. And if you heard the Vice Chairwoman, Rebecca Moore said, you know, Cleveland has some of the highest lead levels in the country. This is not just a CMHA issue. This is also a Cleveland issue. And to be honest, I'm very passionate. Sometimes people think my passion is like I'm just mad, angry, frustrated. But if you grew up the way I grew up, you will understand that I oftentimes want people to understand where I come from. I am a CMHA baby, born and raised in CMHA. December 17, 1988, I came home to the blues, the colors, King Kennedy's back in the day. So when I speak sometimes for people that come from my neighborhood, oftentimes people don't understand. And I'm okay with it, but I tell them I definitely know how to articulate myself. And if you miss it, that's on you. Maybe you need to get out the house more. But my number one concern that I have is, in 2022, I brought up concerns about lead safe in CMHA. I didn't have no record, didn't have no data. I just had a feel because I understood that properties built before 1978 was proven that lead inside of the paintings was used to build those properties. Then nobody wanted to listen. Nobody wanted to help me. Nobody really wanted to move on or tackle that tough issue. Nobody wanted to help me. And what I mean by that is no one wanted to roll up their sleeves to say, let's go have a tough conversation with CMHA offline. And that's sad with me. Then in September 14, 2023, I attended a meeting with the Lead Safe Coalition, and I asked them at that Lead Safe Coalition, we have invested hundreds of millions of dollars into this fund to be able to try to figure out how to get lead out of our properties and our places in our community in the city of Cleveland. No one wanted to listen to me at that meeting. by the grace of God, I thank for having a good colleague, Councilman Harrison, who hosted a DPS meeting, and I was able to get some clarification through the chair to Director Sally Martin in Building Housing, like, what is your regulations? How can you help make sure CMHA is in compliant? How can you support us? And I got clarification that there are certain things that the city can do to help regulate. But she also ensured that federal government has some different authority and supervision, oversight that they have, but the city itself can also enforce that process. But why does it always got to take 2 years, 3 years for us to just roll up our sleeves? And that's my problem that I have with this. So my first question I definitely want to get clarification on through the chair is to Mr. CEO, Mr. Patterson. How long have you been with CMHA as an employee?
Mr. Chairman, to the councilman, I want to say 22 years.
Okay, so about 2002. And prior to you becoming the CEO, you served in what capacity at CMHA?
Mr. Chairman, to the councilman, Director of Human Resources.
And then around 2012, you became the CEO through the chair?
Mr. Chairman, to the councilman, yes.
So one of my questions is, I asked is, 22 years, HR, best practice. During that time prior to you becoming the CEO, do you recall, through the chair, any type of work that CMHA were doing to address lead issues in their properties? Given the fact that we know that CMHA had properties built between 1978 to now, through the chair.
Mr. Chairman, to the councilman, a lot of the things that Mr. Wade articulated are things that had been going on in the sites, as the other Mr. Wade mentioned when he was up here before. There was a lot of training that was done at that time also. Do I believe that there needs to be more? Do I believe that we need to have an increased focus on it? Do I believe that we need to work harder to address those things? The answer to all those questions is yes.
Thank you. That is very important because me, I'm always about the accountability. Like, I understand that when things were built in 1933, obviously, if people don't understand the history, Ernest Bond, who was a council member, who was a state representative, who was fighting for housing equality, coming up with these different properties, we also understand that the paint back then was all lead infested. So my question is, I've seen in the presentation would be, currently as it sits today, out of those properties that were built between 1978, I know CMHA have done some renovation, have done some clean out. How many total properties do you currently have that were built before 1978? Through the chair to the table, or to Mr. Patterson.
Mr. Chairman, to the councilman, I would probably say that we have somewhere between 6,500 and 7,500 units that were built before, but don't hold me.
Yeah,
it's
just rough. Thank you. So if we can, we get that number offline.
I will make sure I get that to you.
Staff, make sure we get that actual number. So my question is, that's where we dig in deep at. CMHA was the first, not the second, not the third. It was the first public housing authority created to be able to say, hey, we need to use some government assistance, some HUD funding to be able to figure out affordable housing in our country. And they were the first organization. So they are the first ones to deal with a lot of issues and step to that challenge. But at the same time, now we're like, being the first, how do we take the initiative and lead into changing this? And that's where I get frustrated at, for me being a person, a resident, like, hey, you know, once that report came out that there are possibly families tested with lead, I had a father call me. I don't know how they would get my number, though, but they gave me a call through the chair. Yeah. The father called me and mentioned, yeah, I think my son got a lot of lead. I said, where your son at? He said, my son in prison for 17 years for murder. And that's just from them seeing the headline, seeing the report, to figuring out like, hey, my kids was living in public housing, living in CMHA housing, which is frightening and which is disturbing. So my question would be, all of these 6,500 units is there a way that CMHA can show that they have been tested for lead levels or abatement or anything has been done through the chair to Mr. Wade?
If I could
Yes,
say,
Mr. Bass.
Mr. Chair, to the councilman, we mentioned that we would be testing all of those units in our presentation. So we're going to commit to going back and testing those units. A number of those units are part of our routine testing that we do. We understand that those units have tested positive for lead in the past, so we will be not only testing those, we'll be testing some of those other units that you're identifying as ones that we need to make sure that we know what the status of those are.
And the crazy, and through the chair, that's important because if we tested them and knew that they had possibly got lead in them, what has been done since we possibly figured it out through the chair?
Mr. Chair, to the councilman, those are the steps that Mr. Wade explained. Each time that there is a test in a unit, we have a protocol for how we go about addressing any potential lead risk, especially as it relates to our PFO process when we are preparing units for occupancy. That's when units are vacant and we're putting new people or people who are coming into CMHA into those units.
Okay, and through the chair, to CEO Patterson, when we, as the city of Cleveland, received ARPA funding, and we were looking at doing lead safe abatement and different coalition and programs, I would ask, why didn't CMHA ask for some money for some lead abatement issues? Because we know this is a problem. Why wasn't you previewed to ask for some money or come to the table to figure out how we can help you all through the chair?
Mr. Chair, to the councilman, we have come to the table for funding for a lot of different issues. The funding from Woodhill, in which we are demolishing those units and things of that nature, are a part of our overall long-term strategy to be able to address that. I have no problem with, as a result of this conversation and these hearings, if we are able to work collectively with others to find ways to support support financially an initiative within CMHA of awareness and training and things like that. We have wholeheartedly look forward to working with you, the chair and Councilwoman Maurer, to make something like that happen.
Thank you, and that's through the chair. That's where Chairman Conwell, this is where I get frustrated. It seems as if I don't scream and holler for poor people, the city don't even think about poor people. We had all this money. We created this lead safe coalition who has done nothing. Nothing.
I mean, that group that received $100 million.
They haven't done nothing. They haven't scratched the surface of doing anything. I went to a meeting September 14th. I seen the report, and a breakdown of nothingness. Empty promises and empty hope. But we knew without the data that public housing, which is a large part of the homes that were built before 1978, potentially had lead in there. Instead of us taking a leadership approach, we figured out creating a coalition to get some money to do nothing, not even go to the neighborhoods that we know needed it. So it's like, my question is, I had to ask Mr. Patterson why he didn't come to the table. My question is, why didn't we go to them? Why didn't we put stuff in place to help them out? And this is just a leadership and accountability strategy. Now, I know Mr. Patterson has been at CMHA for 22 years, and I commend him for the work that he has done as far as a lot of properties you tore down. We want to get rid of lead, we got to tear down and rebuild. We can't keep band-aiding it up, so I do understand the different programs, the different grants, the way you're looking at addressing Old Cedar, Outhwaite, Lakeview Terrace, and coming up with different strategies. But I'm afraid to say that we still got to do something because people are living in these buildings right now. So my question would be, is there any plans? I know you gave up a whole bunch of different plans about what you're trying to go to address this lead issue, but is there any plans to have the youth that live in our buildings currently tested by healthcare provider, to be able to test all of them as soon as possible? And if so, a rough time schedule or estimate time schedule, is that something we can talk about moving forward today? Because that is something that is needed through the chair.
Sure.
Mr. Chairman, Mr. Chairman, to the council, that's something that we would be happy to coordinate with the Cleveland Department of Health on and other entities. It's not something that we could do ourselves, but just as we have done in the past with getting the vaccination for people at our sites, the testing for COVID-19 at our sites, we would be willing to partner with licensed, trained professionals to make those opportunities afforded to our residents.
I think that is great. And
Mr. Starr, with this group, what's that? The Cleveland Coalition of Lead? Lead Safe Coalition. Do they report to you, Director Hernandez? Do they report to you?
Through the chair, to the chair, there, yes and no. So the accountability, because the dollars flow through the Department of Community Development, yes, we get regular reports and we are in contact with the Lead Safe Coalition on a regular basis. I am happy to say that though there was a slow start, so that September date that you talked about last year, where there was difficulty in getting the programs launched, there has now been quite a bit of movement the dollars have been flowing. So to date, of the total amount received from the city, $6,414,000. The total spending to date has been 42%. It's not where we want to be. We want to be further along, but over the past year, there has been quite a bit of movement on those grants, and we are meeting on a regular basis. The mayor has brought on Emily Collins, who's at the end of the table, to help quarterback this effort, both with our partners across that work on lead across the city, as well as those that work across the department, getting building and housing, community development, as well as health. In the same room, making sure that we are on one accord. So we have a progress report that I believe is due on Friday, but we have seen quite a bit of movement. We are getting started. It was a slow start, but we are through the work of the coalition and all of the partners that are involved. Changes are being made and money is getting out the door.
So you'll give me the progress report after you read. You'll see it Friday. Is that correct?
To the chairman, yes, I believe Friday is when the report is due, and after we've done our analysis, more than happy to share that. I often share the reports with Councilwoman Marr, with our vice chairwoman here, on a regular basis. So happy to share that. But like I said, after a slow start, the coalition is working, and I think the most beautiful thing is we finally gotten into a bit of a stride, and right now we're in an analysis phase, right? Understanding what's working, what's not working. If we said we were going to put money towards this thing, but it's not maybe working as we anticipated, we have a group of folks that are willing to pivot. So that we can get it right. So I am happy about the trajectory that we are now on, though I fully admit that it has been challenging to get to this point.
So, Emily, you just started, right? Welcome aboard. You started.
Chair, I started in October of last year, so.
So you know what we're looking for, the goals and objectives.
Oh, absolutely, yes.
We want to know the dependencies, where they're headed at right now. I like to also look at what milestones they've reached. Just telling me you gave out $6 million. I'm not talking about you, Director Hernandez, but when you tell me that we spent $6 million or whatever the case may be, that means nothing to me.
Sure.
It means something to me. Are you hitting your milestones? Are you goals and objectives? Are you reaching those? That means more to me, because it shows work. I'm not beating up on you, but that's when I read progress reports. So that's what it is.
Chair, I appreciate that. And we are also looking at the lead safe auditor's role, which is created by city ordinance, to make sure that that's the most effective it can possibly be to report in a better way to you all.
So do you have, when you give me the evaluation process, just let us see the tools that you're evaluating, pre-testing, post-testing, so that we, Councilmember Starr and the committee, so that we know. And we don't have to host a committee meeting. We could just have a meeting off of the side on it. We can do that.
Chairman,
Director.
happy to do so. Just for the viewing public and for folks that maybe are just now following along, the services that the Lead Safe Coalition is providing through these ARPA funds, grants for property owners for lead safe home repair, lead safe certification incentives, emergency housing assistance for households facing housing insecurities due to lead, workforce development, making sure that we're priming the pipeline and that we have enough folks that can do the testing, right? There's a whole workforce component to it, as well as screening and testing. When I look at the progress, the lead safe certification incentives continue to perform better than expected. And we've intensified efforts to build capacity, expedite home repair grants and incentives. Home repair grants, there's 150 applications that are approved, in progress, or in initial inspection. So this is real work, real impacts that are happening. So that this is what represents that 42% of the spend down. Environmental Health Watch has been selected as a relocation assistance partner. There has been a total lead safe certification incentives of 3,469, and in Q2 of 2024 alone, 496. So that's for lead safe incentives. So that adds a little bit more. So what I was just saying, and I talked about those next steps and about making sure that we're shifting dollars in the way that we need to. We also recently, through the leadership of Director Martin O'Toole, we have gone out to and received ODOD dollars from the state. So that is additional lead dollars for specific programming for the state. Our teams have been working together. We have selected a third party through CHN to do some of this work, and that contract was, I believe, certified within the last week. So progress is absolutely happening when we talk about citywide outside of the CMHA.
So, and I'm going to yield right back to you real quick. Do we have the capacity to, let's say, to shift to work with CMHA? I mean, they're in our scope. I mean, it's our job to write legislation for people that live, work, and travel to the city of Cleveland. So if they're in our scope, are we able to work with CMHA as well?
Thank you for the question, Chairman. I do not have a quick answer for you, but what I can say is that the group of folks that are working on lead are more than happy to have conversations, to talk and see, like I mentioned earlier, where shifts need to happen, if this makes sense, if we are ready to go and we have willing partners. Everything I know about CEO Patterson and even what he has said today represents, I believe, a commitment to do whatever is best for especially the children in CMHA. I think as a city, we'd be willing to certainly have that conversation. Of course, the dollars that are already allocated do have uses that they're intended for, and we do have agreements and contracts that follow that process.
Right.
But from everything I know, with all of the committed partners that deal with lead, I would have no problem saying that folks wouldn't have an issue at all sitting down, having a conversation, and saying, how can we get resources to those most in need?
Thank you, and then we'll figure that out. I'm sorry, Councilman. You brought the question up, so it made me dig into it to see what's going on. I yield.
Anytime, Chairman, you do this on the phone with me all the time. I just be quiet and listen. I hear you. But within that context of the Lead Safe Coalition and the things and the role that they play, how many active inspectors do we have through the chair to either Director Hernandez or Sally Martin to be able to do this type of work?
Through the chair to the councilman, just so you know, with the lead safe work that we do, it involves private lead risk assessors and lead clearance techs. So it was on the part of the coalition, a job creation method, and these are people who are certified with ODH to perform those functions. In-house, we are establishing a 1 to 3 family lead compliance unit. We're putting 3 inspectors and a chief in that role. But in building and housing, we have over 20 people certified as lead risk assessors. But as stated, with our lead safe work, that's typically done by outside contractors that are hired by the property owner to do the work.
Yeah, that's confusing. You got to bring me back. You got to bring that all over.
We have another handful or so, 5 or so. We've had some recent retirements and some new folks coming in that are within the certification process. But all of community development inspectors are going through this lead process as well. And so it is if I can try to put a finer point on it through the chair, we are using a combination of both internal to City Hall and to our processes. We have folks that are hired to go out and are able to verify lead and able to get the certifications through. Sure. But the primary tool, because we cannot do it on our own, the primary tool has been let's use this opportunity and these dollars to increase the workforce. Mm-hmm. So part of these dollars are for, through the Lead Safe Coalition, go to training through Environmental Health Watch. I know that there's a lot of partners, but that's a good thing. There's a lot of layers in this, but training happens so that if you or I believe, do you have a lead safe? Are you? I know you're a jack of all trades, Councilman Harsh, and so somebody can go and get that lead certification, and folks are able to start their own businesses in doing this work. I hope that clarifies it a little bit. It's a multi-layered approach with a lot of partners.
Yep, and I thank you for that clarification. So hearing that is basically we don't have enough staff to do it, because if we talking private versus what city already have, that means we really can't support CMHA the way they need it, because they still have to go out and find private people who could possibly do that work, and we know in the private industry we probably don't have a large pool either. So when I look at it, we basically need about 100 different inspectors if we're going to be honest with this type of work. And that's where I can't sit here and put it all off on CMHA. It's got to be a partnership. It got to be a relationship. It has to be a city working with those in our city to say, hey, this is how we're going to help you. This is how we're going to go after these HUD grants. Because when I looked at a HUD website, they have lead hazard reduction grant program. They got healthy homes production grant program. They got the lead-based paint hazard control grant program. They got the lead technical studies grant program. They got the lead outreach grant program. Now, I'm a guy that believes we're rated as the #1 poorest city in the country, top. So if we're going after funding, I think sometimes we get the nudge or get that funding if we package everything together. If we going after these HUD grants in collaboration with a CMHA, in collaboration with an Arbor Park, a collaboration together, say, hey, we need extreme amount of dollars to build the workforce, to hire the 100 inspectors to be able to do the work. Not just inspectors that have $40,000 a year. We got to really pay them some money, because we're going to require them to possibly do 5 units a month. We can't be looking at it, because when I looked at that report from 2023, it went from doing 5 units a month, it decreased down to not even that many. And then we start saying how much work is getting done. Then you start having me read all these articles at late night. And then I start asking people questions. And then I'm like, yo, it's not making sense. So, like I said, I'm not here to beat up on CMHA or anyone. I'm here to figure out what can we do to help the people. Because at the end of the day, we can't have more kids like Demetrius Wade, who passed away and lost his life, and it was due to high levels of lead. And that's a fact. We cannot sit here and say, the lead levels that are peak high, when we got the highest in the city of Cleveland across the country, and then you look at the violence that's going on in our city, there gotta be a correlation. If I got high levels of lead, and it started when I was a young child, and I never got tested because we don't have the healthcare system or the relationships in place, healthcare providers are moving in and out of our communities, so our kids are not getting the right healthcare tested. We looking at it and saying we're all failing. It's not an I, it's not a you, it's not a me, it's all of us together. So this hearing is for us to get an understanding that we got some work to do. So even if we was from the class recommendations to amend Cleveland's Residents First Lead Safe certification laws, I'm not even sure the city has enough mandate or enough inspectors to help us get to that point. And that's going to be something that I'm going to work on offline to see what we can do. Because I know the city love to find money when it's something that they want to address. But when it comes to poor people that look like me and grew up in my neighborhood, I got to argue and act like George Forrest for somebody to hear me. And that's the problem that I have. So I will yield, Chair, and I will pass it over to Director Hernandez, because I know she got some stuff, but we got some things, we got some work to do.
Okay. Director, you want to close it up?
Yes, very.
No, I know. We're going to you, Chris, but she asked could she say something?
Very quickly to address some of those items through the chairman. We do have a limited workforce, right? That's why the dollars were allocated in the way that they were allocated, to help increase that workforce. We know that we have a workforce issue. This approach is going to have to be an all and. This is not an either or. This isn't a CMHA or an Environmental Health Watch or an Enterprise or a Mount Sinai. It is an all and, right, approach. It's going to have to be. And what I will say is that independently and prior to my taking over the directorship of the department, we have had 3 to 4 active lead programs. So those things that you read out, Healthy Homes, we have it. We have a Glenville-specific lead grant. We have a 2021 and I believe a 2019 lead grant. So these are through the work of previous leadership, going out, getting these additional dollars. That is more than the regular CDBG, HUD formulaic dollars that come through. So it is a known issue. It is something that folks have had the foresight to say we need additional dollars. But we don't do home repair well. I have never said at this table that we do home repair well, but we are working on it. We are currently, and I've shared some of those plans, and I'm going to hold off on getting into the details of what we're doing for home repair, but please know that lead is absolutely important, an important issue. The safety of our children is foremost on our minds, as with those in our community that have the most need. And so I really do want to, I'm going to push back, Councilman, a little bit on the we don't care about poor kids, because that is just not, that is not true. That is not fair. We work every day. I think I can speak for everybody here at the table that this is not taken lightly. And so I will respectfully push back that we do care and we are working towards.
I'm going to yield to Councilmember Harsh, but let me say this. Glenville lead project, the last time I checked, is not doing well. No. Right, at all. So I need to meet with you and talk about that, because we can't, I think it's $9.7 million. We can't lose that. We got to make sure that is strong. You know, I'm not.
Yes. And under new leadership, Chairman, through the department, that reorganization that you all supported me and that we've just now completed, I have 3 new layers of leadership that are now overseeing this process.
Okay.
It will take time, but we are turning a corner on this work, and we will do better.
Chairman, to clear up, and I'm done.
You
30.
just wanted to come back.
No, I don't want to come back.
I got to do Chris
I got
Harsh.
you.
I have Chris Harsh.
I know because you took all some of my time too.
I knew you were going to say that. I'll give you
30 seconds. No, and I agree with Director. And what I mean by I care about poor people, if we knew these properties was this bad, why the city hasn't done nothing yet? So not to push back, I'm just speaking on the fact. If we knew that CMHA had properties that were built since 1937 and people are currently living there, the city hasn't done nothing to work with them or hold them accountable or put some of those grants or funding into the program. We got a whole Lead Safe coalition and we put all these dollars in there. Not once has we said CMHA, not once have we said any public housing, not once at all. So my interpretation is all off of facts and work. If I seen something come to the table, I would definitely agree, so we can agree to agree.
30 seconds.
Yep.
I'm going to yield to Chris Harsh. I do not like about you guys not reporting those 10 children. I mean, that's crawling in my heart a lot. And I just got to tell you that that's not good. That's what we're going to visit you. And you got to do reporting to the city of Cleveland, to the health department, and we'll put class and those different groups. Why didn't you report the 10 children?
Through the chair, just to clarify the health department piece, so we get the lead cases reported to us through the lab and through Ohio Department of Health. So it's not true to characterize that they missed reporting to us. It's just, those cases were being investigated by our team.
But the HUD, the 10, the HUD.
Right.
I'm talking the HUD.
I heard you say city health department, so that's why I wanted to clarify.
You, but the 10 kids to HUD. I mean, you looking out for CMHA and everything. I understand that. Those 10 kids is just boiling in my heart and in my soul. And it's children. And children, someone got to look out for children. It's our job as parents, it's our jobs as adults to look out for children. Children gotta know that they can count on you. And you guys did not look out for those children. That's burning it in my soul and in my heart a great deal. I look at the systems that you're putting in place, but someone should have been there monitoring and controlling, looking out for the children at CMHA. That's burning me up right now.
Understood.
I mean, I'm on the inside burning. I got to tell you that right there.
Understood.
And I'm not a happy camper.
Understood.
With that. And I'm serious, it can never happen again. And like the council lady over here mentioned, Rebecca, I don't know the outcome measures from the 10 children and the cognitive behavior they might. You just don't know the road that it might end up leading to. And someone got to fight for them, man. Somebody got to fight for them. As a parent and as an adult, and fatherhood, the whole piece, that's why I was burning up on the inside. We'll monitor and control the systems, but I mean, that's just the reality of it. And it hurts. It hurts a great deal. So that's what I meant. Chris, Councilman Harsh.
Thank you, Mr. Chair. I don't want to beat dead horses, but to the director's point, I was a state licensed lead risk assessor back in 2006. I re-upped my license back in 2016. I've conducted lead risk assessments, and I've conducted dozens and dozens of clearance exams. We could talk about the downfall of Rome and the ties with lead poisoning to that. We could go back into history. We've all known about the hazards of lead for well over a century. It's not new science. It's not a new problem, and lead has been living rent-free in my head for decades. So, as just sort of preface, I'm not shocked that we're here today. I always expected us to be here having this conversation again. I'm sure this will happen even more in the future because we are all paying so much attention to this issue and because we are trying to get to the bottom of it and put an end to it. I don't expect this to be the last time that we sit at this table and talk about lead poisoning in children. So to get started, through the chair, is it CEO? Is that your official title, sir? It seems like CEO is a sort of hybrid title that people get thrown all the time. Are you the
That's my title.
You are CEO, okay. CEO Patterson. How many units of housing does CMHA manage in Cleveland?
Mr. Chairman, to the councilman, about 10,500.
10,500. And through the chair to the CEO, how many people live in those units?
Mr. Chair, to the councilman, I want to say somewhere between 20 and 25,000.
Okay.
Again, you get me on my numbers.
No. People, when they move out, we'll say 2.5. And through the chair to the CEO, would it be adequate or would it be accurate to characterize the population under 10 as perhaps, 12, 15%, 20%?
Mr. Chairman, to the councilman, I'm not certain, but that's information I can't provide to you.
Okay. So there are thousands of children living in CMHA and CMHA managed units. And we're here today because 10 of them were found to have lead levels 5 above 10 micrograms per deciliter and 5 below. That's what brought us here today, correct? Okay. Through the chair to the CEO, the 10 children that we're talking about, were they all living in estate housing or were they in housing choice units? In other words, were they all living in units built by the federal government at some point, or were they living in those housing choice voucher units that are off-site?
Mr. Chairman, to the councilman, these were all in the public house. These were not voucher children, correct?
All estates, okay. Through the chair to the CEO, did we determine the cause of their lead poisoning? Be it the unit, be it another form of lead poisoning. Do we know where these children got poisoned?
Mr. Chairman, to the councilman, I defer to the health department.
Sure, yeah. So through the chair, so I don't want to go into the specifics given, protected health information. But when we go into a home and do an inspection with the XRF gun, with the wipe test, with the soil tests that we do, if we don't find evidence of lead paint dust or, and lead poisoning, we then work to figure out, what other homes are they spending time in. If we find that they're spending time in homes greater than 6 hours per week, we'll do an investigation of that home. Or if we learn that they just moved from another jurisdiction, or it's, we'll reach out to that local health department of that other jurisdiction, for example, Cuyahoga County. And so we don't stop when we just, find no evidence of lead poisoning. But I can say that in those cases, we determined that the source of lead poisoning was not the CMHA property.
Was not?
Was not.
Okay. And through the chair to the director, was that all of 10 or 5 of them? Or?
Through the chair, so that's for our investigations of greater than 10 micrograms per deciliter.
So that was 5 of the kids.
Absolutely.
Okay, we're not the unit. Mr. Chair, I bring this up because I think it's really, really important for us to understand how ubiquitous lead is in our society. I worked with a landlord in the Clark Fulton neighborhood. We were trying to find emergency housing for a family of refugees who I believe were coming from Afghanistan. They had a number of children with them, and we found a local landlord who agreed to house them almost overnight. And we moved this family into this house, and things were looking good. And a month later, one of their children tested well over 20 micrograms per deciliter, like 24, 25, a dangerous level of lead by any standard. Because when I started this in 2006, we used 15. But even back then, 24 micrograms was considered highly dangerous. And the landlord called me, Mr. Chair, panicked, horrified, scared to death that his unit had poisoned these kids. And I had already gone in and looked through his unit and said, it's a safe unit. I went back to his unit and I looked again. And I said, Mr. Landlord, your unit looks fine. There's no crack. There's no breaks in the wall. The windows are secure. And it turned out, we worked with our refugee resettlement friends who were able to sort of dig in on this. It turns out that the one night they spent in India, they picked up some makeup. They were of a religious faith that put makeup on their children's faces, and the makeup tested 50% lead. The makeup was 50% lead. They had picked this stuff up in a foreign country, were using it on their children, didn't realize that was the cause of their lead poisoning. Lead in makeup is banned in the United States, but the world is round and it's all connected. And they were able to pick this up. And the reason I'm bringing up this story is that while we should be extremely heightened in our sensitivity and make sure these units are tested and make sure these units are clean, it is possible that not all lead poisoning comes from the living environment, the condition they live in. And it's important. I'm not saying it didn't. I'm not saying that it won't in the future. It will in the future still cause people. But it's important because there are other sources of lead paint. We just had a problem a couple of years ago. We were finding toys coming from China where they had lead paint all over them because the Chinese government had not yet outlawed lead paint. And to remind people, lead is a fantastic additive in paint. There's a reason they put it in there. It's cheap. It makes it strong. All these positives that the manufacturers find. Which is why we were protesting Sherwin-Williams, Mr. Chair, so many years ago, because we knew that they knew that adding lead to their paint made it a toxin. They knew about this when they were doing it, which is why the federal government outlawed it in 1978, and we no longer produce it. But we knew that they knew 100 years ago, right? That's why we went out to Solon and protested, you and I.
In front of the head of Sherwin-Williams.
In front of the head of Sherwin-Williams, which upsets people in Cleveland because they're a major employer. I had friends who were working at Sherwin-Williams while I was leading protests to their CEO's house, right? It's a complicated issue. And we don't want to ever reduce the issue to one thing because we might then lose sight of the other problems that are associated with lead. It comes on toys. It can be in makeup. The world has not gotten together and banned lead yet. There are still uses of lead in coatings and sealants. So, that's why I wanted to ask if we were able to determine conclusively whether or not the units were the cause, and it sounds like we have not been able to determine that, so there might even be other issues at play here, but I think an elephant in the room, and two, the director, the CEO, my colleagues who helped draft the Residents First legislation through the chair, I believe CMHA is exempt from the lead safe certification requirement that our local landlords are being held to prove that their unit is lead safe. I believe that we exempted CMHA through the chair. Is that correct?
Mr. Chair, I defer to Mr. Wade.
Through the chair, that's correct.
Right. And through the chair, I believe at the time that we drafted that, we were of the assumption that federal oversight would be able to take care of CMHA's units.
That's true.
And that's why we exempted them and agreed to exempt them. And through the chair, I think that our friends in clash, recommendation number 4 here is that we end that exemption.
Yes. Yeah, we're going to have to.
And through the chair, I think that we need to consider that. We need to consider ways to do that. And I know that we're not here to have that conversation right now, but through the chair, I believe that the Inspector General of the United States Department of Housing and Urban Development actually had some oversight that worked. I believe, Mr. Chair, that this report came to us because a level of government oversight found a problem, brought it to everyone's attention, and we are here having a conversation about it today because perhaps this level of oversight is working, and we should have a conversation about whether or not this is a success or a failure. Not for the 10 children. For the 10 children, it's a failure. And we will, unfortunately, continue to fail children throughout this country who continue to be lead poisoned because we have not eliminated every wooden window. We have not replaced all wooden windows with vinyl, which, by the way, is toxic in its production and destruction because it creates dioxin, the most cancerous chemical known to humankind. But it's preferable to wood and the lead paint that's on that wood. We will have lead-poisoned children so long as we have lead on walls and houses built before 1978, and we're not demolishing the entire city. We will continue to have lead-poisoned children in Cleveland, and we will continue to monitor, and we will continue to, might I say, panic every time we do, because every time a child is poisoned, we need to panic. We need to figure out what caused it, how to prevent it, and how to treat that child immediately. And I feel good that we have a team as dedicated to this problem that we're all here today with 3 directors and the CEO of the largest housing provider in the city of Cleveland to address this problem. So I think this is some kind of progress. One more question through the chair to the CEO. Does CMHA have the actual legal authority to mandate lead testing for every child in your units? Do you have that authority to mandate it?
Mr. Chairman, to the council, my lawyers are sitting up, so I'm assuming that they're both going to tell me no.
No.
Hey, I got an answer from a lawyer. All right. Okay, no. So this is a problem. So we have always sort of relied heavily on CareSource and our other healthcare programs for children to be heavily involved in testing kids. My kids were tested for lead. All three of my children were born on CareSource, right? We used that healthcare program for all three of my kids, who were very young when they were born. But tested through CareSource, who said, come on in for your annual, and we said, yes, go test them, right? Because I wanted to know. And I think that is still our primary way of finding out whether or not what children's elevated blood levels, because as Councilwoman Moore is fond of saying, schools are too late. By the time kids get into school, it's too late. We're trying to prevent lead poisoning before the age of 7. So maybe through the chair to the director, Director Margolius, what are we doing to test, and I heard Councilman Starr also bring this up, what are we doing to test our kids when they're 1 year old, when they're 6 months old, to make sure that we're getting in front of this problem?
Sure. Yeah, so through the chair, just to clarify, it is a state requirement that any child at age 1 and 2 is tested for a blood test for lead. And so it's not just CareSource. There are 5 or 6 Medicaid programs now that require that. And then it is a standard of care in all of our Cleveland-based healthcare systems that children are tested for lead at age 1 and age 2.
And through the chair, though, to the director, the state still can't mandate that those parents bring their kids in for that test.
So through the chair, there is no penalty on a family for not doing a blood test of their 1-year-old, and nor should there be.
Through the chair to the director, do we have any idea what percentage of children are never actually tested because of parental neglect, for lack of a better term?
Through the chair, I would not characterize that as parental neglect. I mean, that's the systemic racism and systems of oppression and poverty that has inflicted our city over decades that has caused that divide. But our lead screening testing rate at the moment is in the 40% range, 40 to 45% range.
40% are being tested or not being tested?
Are being tested. So it's incredibly low, and still, based on our 2023 data, has not recovered from where we were in 2019. The societal responses during the pandemic set us back as a community in terms of health outcomes. Between that, absenteeism in the schools, just really crushing. And so we're starting to climb out of that, we believe, but our role as a health department absolutely is to increase the testing rate in the city of Cleveland, not necessarily as the testers, which we've spent some time talking about, but in connecting 1-year-olds, 2-year-olds, families to pediatric medical homes, so that not only are they getting that lead test when they're 1 and when they're 2, they're also tested for anemia. They're given a complete physical exam. There's about a dozen vaccines that they get. There's anticipatory guidance that they get. So we think it's incredibly important for our role in helping families get connected to a pediatrician for those tests.
Okay. Through the chair to the director, it is discouraging that 60% of parents are still not able to get their children tested for whatever reason. I remember taking my children into the pediatric checkups, and they asked us about the lead test, and we said yes. I don't know how every primary caregiver handles that situation or how it's prescribed to be handled, but
through the chair, if I may, so it's complicated. I mean, it's a huge challenge, and so one thing that we know that is happening is a parent will come to a visit with their 1-year-old, and the pediatrician will order the test. And because the test requires a very specific type of phlebotomist who can, find a vein on a 1-year-old baby, which, anybody who's spent time with 1-year-old babies knows that it's really tough to, get a baby to sit still, let alone find a small vein in their arm. And so there are many cases where the parent is doing everything right, but the system doesn't have that phlebotomist there at that specific time to capture the result. And so the test is ordered, and it's, all right, come back later to get that test, and that doesn't always happen.
Yeah.
And then there are the children and families who are just moving between different locations, different homes due to all the systems of repression that we've discussed, and aren't able to link in with a pediatrician, or aren't able to, find someone with access to care. Maybe that appointment is 3 or 4 months out. And so there are a number of challenges, all of which we're working to overcome, but much more is needed to do that.
So I think it's a really good example that we're going to have this conversation again. We're going to find more heartbreak. We're going to find more failures, and we're going to find more times where the system does not do everything we hope it would do, and people that fall through. Last thing, real quick, I just want to say, because I've done so many clearance exams and through the chair to the general public, a lead risk assessment is designed to figure out how much risk might exist inside a structure, and a lead risk assessment is very prescribed. Wall, surface, every painted spot, every time you turn a corner, you paint a new, you test a new spot. You can do it with XRF guns. You can also do them with wipes and everything. A lead clearance, a lead risk assessment is designed to determine how much risk might exist in that unit, not how much exposure there is of lead, but how much lead might exist in that unit and what the risk level of a unit is. A lead clearance exam is designed as a much lower level test that is designed to determine whether or not there is an imminent threat to the occupants in that unit. So it tests a smaller number of surfaces. However, both a lead clearance exam and a lead risk assessment begin with a visual assessment. And the visual assessment is the easiest thing in the world to fail, because all you have to do is walk in and find chipping, flaking, cracking, chalking, bubbling. Any painted surface that is not in perfect tact is an automatic failure of a visual exam. And it is the easiest part to walk in, look around, and say, this unit fails. That's why it fails. I don't even need to pull out my test. I'm just telling you, I've got eyes, I can see it, and that's why this unit has failed, and walk right out. And you don't have to do all the other work, because you just write F on that exam, and you give it to the person who's in charge of handling remediation. And the person in charge of remediation then has the task of going forward and figuring out how to address the failed parts of that. So when we were having a very early conversation between the councilwoman and the gentleman here, I was thinking about how a risk assessor or a clearance examiner could walk into a unit and say, well, no, I'm not even going to bother. I used to actually walk in for landlords and say, I'm not even going to charge you for this one because you failed. I don't even need to test. You failed 5 minutes ago when I walked into the living room, and I'm not going to bother even charging you. But there are reasons that an examiner or a risk assessor will go in, declare the failed visual, and I don't even know if the state requires you to even write the test at that point. I mean, to write up the paperwork, but you can bypass the physical wipes with a failed visual. And to that respect, I would remind everybody, the #1 prescription for preventing lead poisoning is actually clean paint. It is totally true. You don't want holes in the wall. You don't want cracks in the wall. That's where the lead gets through. Your windows, sills. I failed a vinyl window once. It blew my mind. Almost every time I did a lead risk assessment, I knew when somebody was going to fail, and I said, do you want me to go forward with this? Because you're probably going to fail. I can see the paint in the well. Windows are where almost everybody fails. And it was a vinyl, and it failed, and we found out later it failed because they were scraping the outside of the house next door. And the house next door, dust floated in through and settled on the vinyl window. They had not washed the vinyl window, and that house ended up failing their clearance exam on a brand new window because of the neighbor's house. And that's how much lead is in the environment, and that's how lead travels. Ms. Hall was pointing this out, right? This is not a problem that stays put, it moves. And so we're going to have this problem, and I would question my colleagues to ask, A, should we make CMHA beholden to the resident's first requirement that every other unit is? B, do we consider this a success or a failure of the systems that are in place that we're here having this conversation at all? And Madam Chair, I'll yield. Thank you.
Thank you very much, Councilman. Unless there are any responses from the table, I will turn it over to Councilwoman House-Jones. Oh, I'll turn it over to Councilman Life.
Thank you. Start with a question and a comment, or a request and a comment. The pie chart that showed the breakdown of, is my microphone working? Yes. some of these microphones don't work, just so everyone knows. We're working on it. All right. Well, it's for TV 20 even. The pie chart that shows the breakdown, the three categories, is it possible to get that mapped and kind of get us, whether it's by, an actual map or a breakdown by, like state or something like that, just so we can kind of get a sense of how that breaks down across the city?
Mr. Chairman, to the councilman, yes.
Okay, thank you. I think that'd be useful. And a comment, and knowing that I might be out over my skis on this one, I don't think anybody at this table disagrees, kind of to go back to the testing question that Councilman Harsh asked, I don't think anyone at this table disagrees about the systemic, decades-long, centuries-long systemic issues that have led us into these crises that we're trying to fix today. And certainly with this, redlining, disinvestment, medical malpractice, and racism, all of these things certainly do contribute. My worry is that there's a lot of work and I think good intention among everybody at this table, in this building and elsewhere, to overcome those systems of oppression. And I worry sometimes that we don't focus enough energy on conveying what we're doing to help overcome these systems. And in repeating the fact that these systems exist and have existed, we unintentionally contribute to this confidence, this crisis of confidence in leadership, and it reaffirms people's feelings that these are intractable and that people don't care. So I want, and we get a variation of this, I think, as council members, where people will say to me, well, you council members don't care about us. I never hear from you. I'm like, oh, I'm standing on your doorstep. Like, what could I do? What could I do beyond this to demonstrate that I care and I want to be here and I want to represent you? But this, even with voter turnout, there's organizations that say, well, people don't vote because they don't have faith in leadership. And in my opinion, some of those very people then turn around and are negative about leadership. And of course people don't want to vote. This is the input they're getting. So I'm not advocating that we need to create some propaganda arm that suggests that this building is infallible, because that's certainly not the case. But I certainly don't want to not acknowledge the things that we are trying to overcome, but I want us to think about how we can maybe more meaningfully convey all the work we are doing, so that the only thing people aren't hearing about is that redlining got us to this point, and racism and medical malpractice and medical testing and all these things, that's not the only thing that they're hearing, that they realize that there are earnest efforts to move into a better future, and we are trying to get people to come along with us. So that's my commentary on that.
Through the chair, may I, just to respond to that, my citation of the decades of systems of oppression was in response to which I don't think was intended, the neglectful parent narrative, which, we just want to dispel that that's what's at play here.
Sure, I understood. I want, what can we do as this building to make sure that the way it's being heard by people, and then maybe I'm overthinking it. That's certainly happened in the past. A question about the breakdown to the CEO. When there was and I know Riverside Park was one of them, but I think Carver was another, that these are now effectively lead-safe units. Are those cases, I know there's been a lot of new construction, but there's also been rehabilitation of structures that were built prior to 1978. Are you able to comment on the scale of those renovations? So for example, at Riverside Park, were those gut rehabs? Is there 0% lead there, and the only thing that is pre-1978 is essentially the four walls or of the exterior? Or, are these cases where there's been maybe substantial renovations, but underneath, there maybe multiple layers down, there could still be, lead-based paint?
Mr. Chairman, to the councilman, in general, that information is going to be site specific. Certain things were done certain ways at certain times. I do think for Riverside Park, at a lot of the units that were out there, those were fully gutted, taken down to the rehabs.
Okay.
I think when we look at this information and we start pulling things together, we'll be able to really show the buildings where we have had significant rehab and what was done versus the buildings where we have not had that same level of rehab.
Okay, thank you. And I think that'll be important information moving forward because for my colleagues, Riverside, I know it was rehabbed in 2020 because I believe the census showed a drop in neighborhood population because Riverside Park was mostly empty because of renovations at the time.
It's full now.
Yeah, it is full. But as we move further away from 2020 and maybe there's not a recognition that these units were rehabbed post-1978, people will certainly recognize in many cases that it's a pre-1978 structure. So I think being able to have more transparent information about how the rehabs occurred will go a long way in giving people a reassurance that they are in a safe unit. So we can work on building that together. I also want to clarify the 10,500 units in Cleveland, the 25,000 residents is referring specifically to residents within CMHA-owned property and not people using a housing choice voucher. Is that correct?
Mr. Chairman, to the councilman, that's correct.
So this is where we get into the dumb questions, but as I guess a layman who has less of ingrained experience in this than many of my colleagues, this is education for me and maybe the general public. How does the HUD oversight align with properties that are not owned by CMHA but certainly have a relationship with CMHA?
Mr. Chairman, to the councilman, there is a separate process as it relates to the Housing Choice Voucher Program that we must go through prior to us actually allowing someone to move into a unit. So that's a specific, different process. We can provide that information to the council as well.
Okay, and in addition to providing that to council, back to Councilman Harsh's point about CMHA properties being exempted from the lead safe law, does that, where do housing choice voucher properties fall within in that? Since they are owned by, I'm seeing Director O'Toole nod, but I assume that since they are owned by a private third party, they are still subject to the lead safe law passed by the City of Cleveland.
Through the chair to the councilman, that is correct.
Okay. If anybody wants to, well, I won't ask the CMHA attorneys to be my attorney, but so another county level government, and I have been in a bit of a squabble about shoveling sidewalks. This is going to come back. And because if you live in the city of Cleveland and you own property, you are responsible under the city code to shovel your sidewalks, even though the sidewalk is within the public right of way. And the answer that I've gotten from this unnamed level of government entity, because it's beyond the point right now, is that, well, you can send us a citation, but since we are county government, we are essentially not operating, we are not beholden to municipal law. So I guess my question is, does anybody know why was CMHA exempted from the lead safe law? Is it simply because there are so many structures and it would become an administrative burden and this kind of feeling or assurance that there was another governmental entity looking at it? Or are there actual practical difficulties or impossibilities for municipal government putting laws against other levels of government effectively? Can we remove the exception?
Emily?
So through the chair to the councilman, your question, I think, is getting to legislative intent, which I cannot answer for you all. But I will tell you that it would be remiss for any one of us to give you a legal interpretation of preemption law, which is rife with conflicts and difficulty from the table. And I think it's really important that we all rely on legal counsel to, even if we are going back to Residents First or any other ordinance, to understand if something that we're doing has risks in it that will lead to Sally's, Director O'Toole's, already taxed inspectors to do something that will then be found by a court to not be able to do. And I think that's the risk that we face in taking action. So I just want to be clear that we will not be able to give you a legal interpretation of preemption law from the table. But it's something that we can all look at with legal counsel in hand.
Yeah, we're going to definitely huddle on that after the 7th.
Sure. And I guess my goal behind that conversation, for lack of better terms, is to sort of define the relationship. Because there's a bit of my brain starts spiraling out of control when I think, okay, the health department is being referred these cases, but they're really an entity of the state in that scenario versus the city government, but the lead safe law is certainly the city government. I think that clearly there is an intent here to do all the right things. I'm not trying to fail to acknowledge that, but just from a strictly legal standpoint, what portion of this conversation would be more would kind of be memorialized in something like a memorandum of understanding, which documents but is not legally binding, versus legislation, an ordinance that could cause the city of Cleveland to take enforcement action should it deem it necessary. I'm unclear on that, and I guess I don't want to. I would like some clarity on that as we think through how we can improve this system and understand where we need to work lockstep and have a strong relationship and what our limitations may be. I see Emily, and then we'll go to Councilwoman Moore first.
Oh, I'm being nominated. I'll echo what Emily Collins said, that it's definitely not the right time here to determine that. But I will just say, thinking to like a sort of like law school 101 question about preemption, the idea that there's sort of a existing field of regulations that CMHA is subject to as a federal public housing authority, and then there's a municipal scheme on the exact same topic, is right at the heart of preemption law, and that's why we're going to need a really thorough analysis of this before anyone can determine it. I don't want to like sort of make that an overly bureaucratic answer and say that we're not going to figure it out. I just do think it's something that this is why people both hate lawyers and need them. But
because people often assume I'm an attorney. I just wear glasses. Like, I'm not. I guess I know I'm going long, but I'll wrap up with 2 more questions. One. I would be interested in knowing how CMA does work to promote testing. I hear your attorney saying you can't mandate testing, but I've even talked to you, CEO, about, I spend a lot of time working with like voter registration in Riverside Park, and people have, it very often, maybe the majority of the time, people aren't registered at their current address. So I'm thinking, like, if we know that if we have a pre-existing relationship, how can we, how can we leverage that pre-existing relationship to make sure people are registered to vote in the right place and make sure they're connected to programs or make sure that their kids are getting tested? So can you comment on what CMHA is doing with and beyond the Cleveland Department of Public Health to encourage testing among residents?
Mr. Chairman, to the councilman, that's one of the things that we want to continue to enhance. As I mentioned during part of my presentation, when we talked about the COVID-19 challenge that we had, if we talked about the vaccine, we were able to partner with a number of different organizations that were able to come in and do testing and things like that, voluntary on the resident, but was done at the site. Should something like that be available and permissible through this process, we would be willing to use that same type of system to assist in getting children within our sites the ability to be tested.
Okay.
Good. We like hearing that.
And then my final question, really beyond.
Can I quit while I'm ahead?
Yeah. No, this is probably a softball. But for beyond this singular issue, but just for general maintenance and needs for like tenant requests to a landlord for repairs, and think you got a clogged drain, you got a broken window, those kinds of things. Just for our own education, everyone listening, what is the best way for a resident to report those needs to CMHA, and is there a way for a resident to kind of track and monitor progress of the service request and delivery and things, just for as a need for anybody living in an apartment, essentially?
Understood, Mr. Chairman, to the councilman. The first step is for that tenant to call in a work order. And we will then look at the work order, prioritize the work order, then move towards addressing the work order. The thing that we're working on now, we just converted to a new operational system for us called Yardi, and within that, we had the capability to be able to allow people to be able to submit their requests in writing. And we also are going to establish a system where people could see where they are in terms of the queue to be able to monitor. So that second part is the part that we're coming. We just really got this system over the last couple of years, and we've been taking the steps to bring it all up to speed and get all of the units that we have within our system all in that Yardi system.
Okay, so as that evolves, if council could be kept in, because that's what we hear a lot from residents. It's not necessarily that there's an issue with lead, but it's like, my hot water tank keeps leaking, and I turned it in, but I'm unsure what's happening, on the other side of the phone. So with that, I will stop and turn it over to Councilman House, I presume.
Thank you.
Councilwoman?
Hi, thank you to the director and to the team that is here this afternoon. I have a couple of questions. I know there were a lot of conversations, but I guess for the team of directors that are here, can someone tell me, where is the senior lead strategist? This Karen Detmer who was touted out? Okay, all right. Because I didn't see her, so I was trying to figure out, and where is the connection? Because I see the people here, but what has happened? Where is there? Has there been an identified gap in what has been put out from the lead strategists and the work in the city of Cleveland to what we are hearing now in these findings? I'm trying to figure out, where is there a disconnect?
Through the chair to the councilwoman, I appreciate that question. I think we have not, made any kind of grand announcement in terms of where the former senior strategist for lead sits in city government, but she is now sitting in building and housing, overseeing the lead certificate program. And my title is senior advisor to the mayor for major projects, and one of my projects is lead. So there, it's a slight movement, and Karen's doing a great job focusing on the lead certificate program, but that's just in building and housing. There are obviously additional programs in community development, public health, all involving lead. So I just want to be clear that that's something that I am overseeing. Your question, I believe, was, has there been an identified gap? Is that correct? And are you asking that related to an identified gap in programming related to CMHA?
Correct. So I'm listening to the conversation through the chair to the team that's here. One of the things that Dr. Margolius indicated, Director Margolius indicated, is that, if I'm not understanding, I'm gonna get a point of clarification through the chair to the director. Did our Cleveland Public of Health know about the test results of the 10 children that were at CMHA?
Through the chair, yes. So any elevated lead level is something that our team works on. What the audit spoke to regarding that was communication between CMHA and HUD, which is a separate process, but we just want to reassure the community that the relationship between us and the families affected by lead poisoning never ceased during this time period.
Okay,
That was always
do
happening.
you understand this? There is something that's happening with our systems. If, on one hand, the local partner here in the city of Cleveland knew about, again, from what we're hearing, they heard or knew about these 10 cases, but then the federal partner is, has their report of saying that it wasn't properly reported. There is something happening. There is a disconnect, and I feel very strongly that government entities need to do a better job of communicating so that there are clear messages going out to the community and that there is not confusion, right? So I guess, I guess it'll be coming forth soon from through the chair to the director. Can we expect to get at least some type of summary report as to from the Cleveland Department of Public Health's department what has transpired in this case and how it is resolved?
So through the chair to the councilwoman, so I think, again, we are the local delegated authority for the state of Ohio Department of Health. And so our communication between families, between the Ohio Department of Health, between healthcare providers, between property owners in cases that we have permission, that never ceased. What the audit from HUD is pointing out is a communication deficit during that 2-year time period that they say was corrected, 3-year time period that was corrected in January 2023 between CMHA and HUD. And so the audit was saying to HUD and to CMHA, both of you need to figure out the communications between each other. It's very important to us that the community knows that the Cleveland Department of Public Health was always communicating with families, was always communicating with the Ohio Department of Health and our obligation. But absolutely, we can provide more information on the state of lead poisoning in Cleveland, and specifically with these properties. But we get 300 cases every year referred to our department for children living in the city of Cleveland with a level of greater than 10 micrograms per deciliter, and 1,000 to 1,200 cases per year of 3.5 micrograms per deciliter or greater. And so I think absolutely we need to continue this conversation and reporting the severity of the crisis in Cleveland that our children are experiencing.
Right. So to the chair, to the director, but do you see how like just a regular person might feel like, oh, they're not reporting things? I mean, again, it is based on how we are reporting things where it is presumed that it was missed. Cleveland has failed. Again, this could easily be the narrative. You see what I'm saying? So some type of way, in some form or fashion, we have to improve our communications because, again, if you're saying, no, we knew about it, I just hope you can understand what I'm talking about.
Through the chair,
And
absolutely,
I'm just,
absolutely.
with the shifts in people's titles and things, something is missing. Something is missing, and we need to get there. Again, but through my question for the 10 families, we're through the chair to the CMHA team that's here. Do we have, let me go to the reason how I'm asking my question. As I've entered into this space in Cleveland City Council, and specifically the conversations that the city of Cleveland has around juveniles, and I have been on a mission to have what I would hope could potentially be substantive conversations about what happened to our young people that then caused them to do X, Y, and Z. So that's where this question and framing is coming from. So at this point, based on the testing of the 10 children, what currently, is the profile of the young people in their development and in community? Can you provide an update and that you can share? And again, this is separate, and I always want to be very clear. I'm not asking you to give me names and things of that nature. I just really sharing the profile. Do we know who is tracking it? What is going on with the family dynamics? And the second part of that, do we know if any of the other family members in the household have, high lead levels of any sort?
Good question. Letting your report also.
From the chair to the councilwoman, in the instances that we're aware of, there are just 4 of these families that still remain as part of our managed housing. So 6 of the families have left CMHA. I think your question really provokes the conversation about what is the aftercare? What do we know about these families? What is their trajectory? The only thing that I can respond to you today that we know is that none of the affected children have had additional testing, which indicates that their levels have increased, meaning that they've not come through the Department of Public Health, in that their levels have increased so that there is either a public health or a health care response to that. Outside of the lead levels of the affected families, unfortunately, I don't have a good response to your broader question. That is something that, as our CEO mentioned, we need to improve that follow-on aspect, not just in that the families need to understand, to Councilman Harsh's point, what are all the potential sources of lead that can affect a family, but what are the consequences of that? What could they realize as children begin to enter into primary education, and what will that look like? So there's much more that can be done and should be done.
So thank you. So this is again, I am from a place, I'm like a systems thinker, and these are the things where I'm like, okay, just a follow-up from the chair to the team here, and really probably to the city, right? So if we had, just based on this conversation, we know that there were 10 children that had elevated, blood levels of lead. At this time, 6 families moved out of CMHA, 4 remained. Where are the 6? Are they in the city of Cleveland? Are they in the suburb? Are we tracking it? Will years from now have a conversation with juvenile court justices talking about issues that are, but again, at the same time, more than likely because they were at some point CMHA residents, government is currently still touching those six families. Like, this is the thing where I just feel like we as a system are not thinking, we're not working together. We're not really working to be preventative. And then in 10 years from now, potentially, maybe so, maybe not, there'll be other issues arising, but because we haven't continued on working together in partnership, we're gonna be spending other money from the government to triage a situation that we truly could have worked to be preventative from. It's going to be too late to call, again, in my case, and I'm coming from the juvenile justice perspective, because we in this city are not doing our part to work toward true prevention. If we do not know where the 6 families went, likely they're probably still residents in Cleveland. They're probably still residents in Cleveland. No support, no tracking, but how much other resources, public resources, are going to support the family, but not necessarily probably to the tune that is needed to be preventative many years down the line. And this is where I'm coming from. Like, I just hope that people can understand, like, we have to do better. We are not preventing anything. If it's like, okay, well, people have autonomy and they can do what they want to do, not when we in partnership. There are public investments being made through the duration of people's lives. And I just, that's just thing. I'm gonna move that, because I'm gonna continue to stay focused and,
Through the chair, could I respond to some of that? So I appreciate everything you're saying, and I just want you all in the viewing audience to put yourself in the shoes of the lead team at the Cleveland Department of Public Health. Every single day, my team comes into work, they sign onto the computer, they log into their password into the database for the Ohio Department of Health, and they see new children coming into the database that have been poisoned by lead in our city. They reach out to those families, they do follow those families, they do care about those families until they see evidence that the lead poisoning levels are declining, that they're in a lead-safe home, that the property manager is complying with lead-safe laws that, are under our jurisdiction, because they are, as a delegated local authority for the health department. And for years, this was a health department issue. Lead poisoning was a health department issue. But the health department is taking care of children after they've been poisoned by lead. And so you've heard from our teams, this is not a health department issue alone. This is all of us together. So I appreciate everything you're saying, and I think we need to keep that energy up because, like I said, 10 cases in 3 years of children who are living in CMHA property during that 3-year period. Every single day we're getting cases. Every single day. And the only acceptable number of children who are being poisoned by lead in the city of Cleveland is 0. We would like to retire our lead team. But that is not the case. And as Councilwoman Moore said earlier, that probably won't be the case for the rest of my career and many of our careers. And so we need to keep that energy up.
Director, I hear 10, but they did not report it. That's the key. You're reporting, but CMHA did not. So I don't make light of that. You gotta report it, and I agree with her. We should.
Through the chair, I'm not disagreeing with either one of you, but it needs to be clear for the reporters who are here, for the audience, that we get the report of a child poisoned by lead by the Ohio Department of Health from the lab.
This is the point, I think, when there is a debate on technically if it was reported or not, because the Department of, and I'm saying it was not reported according to the HUD standards, right?
Right.
But then there was some reporting of some sort or something, basically, when someone, help me understand this.
Through the chair, absolutely, yes. So
Help me understand this, because when a child, there is a laboratory or medical entity that gets their results, and I'm assuming they are a mandated reporter of some sort, which then, when this test result says they're elevated blood levels, they send the information as a mandated reporter to the Cleveland Department of Public Health and maybe some other entities. Am I hearing that correctly?
no, through the chair, the law is that the blood lead level goes to the Ohio Department of Health. From there, Ohio Department of Health sends it to us. From there, we do our work.
Okay.
What the audit is referring to is what HUD was receiving from CMHA.
Right.
I appreciate the severity of that report and the headline, but we want to make it clear the work of preventing further poisoning of children never stopped happening. And that should be the headline. And
I disagree with you on that one. The headline should be that they did not follow protocol with HUD, and you had 10 children. See, the problem.
No, could I?
Yeah, all right.
Yeah. So
I just don't take it lightly.
It's not about taking it lightly, but do you understand? It's like just a couple of in the with the report, and this is the other thing. I'm gonna go ahead, Chairman. Go ahead. No, go ahead. Just to get your point.
I understand you're hitting your numbers, your benchmarks, whatever the case may be, but when you don't report and follow through what HUD says, see, these 10 children and these 10 African-American children in my race, where I'm at, it's a lot of things that don't get reported with us. Because in America, I'm used to us being dehumanized. I'm used to that kind of stuff. And so me as a leader, and me as a man and as a father, I don't like those kind of things. If it's one, Director, I don't like it.
That's right.
And it's not good if it's one. And you don't report that one person, it hurts me and it burns me inside. And we're used to being dehumanized. The Tuskegee instrument, the piece, whatever the case may be, that happens to us. And so those 10, although they did not give it over to HUD, that's a problem. That's a problem. That's a problem for me.
So,
And we got to make sure that it never, ever happen again. And she right, those 10 really should be tracked.
I mean, the 300. I know my
But I'm talking
larger,
about-
but
yeah,
let me be
300.
very clear. Let me be clear, very clear. This is not about, while this is about the 10, if there's an indication, if we are known as a city, at minimum 300 children have elevated blood levels greater than 10 here in the city of Cleveland on an annual basis of 300. That is a problem.
Big time
That is
problem.
a problem.
Big time
and
problem.
if we are not doing the necessary work to support the family, track the family, that is the failure. That is how we have the issues. Again, I'm talking about going back to the juvenile justice problems. When I ask the questions, again, what happened to that young person? And we as a system can't clearly articulate it, what happened to that young person to get them to, have many of the behaviors.
Right.
A lot of times it's probably some level of correlation.
And
That's me
learning
just putting
in
out there, but
schools.
we don't
Learning in
necessarily
schools, like Councilman Starr was saying.
know because we do a very poor job of going deeper. We just like to, put out numbers and not work together. That's what I'm saying. That there's a bigger thing. And then I guess for clarification of purposes now, is it indicating that the 10 children who had elevated blood levels, the source of the elevated blood levels was CMHA housing?
So from the chair to the councilwoman, no. We know that, particularly in those cases that CDPH was involved with, that first, there was no lead-based paint hazard found in the home through their separate independent inspection. So we also know that in the cases that our risk assessor evaluated, that while there may have been deteriorated paint in the home, it could not be correlated as a source because the paint itself was not lead-based paint.
Okay.
So when we say, I think one of the things that we need to be careful, when we say that a unit has lead-based paint, we make that characterization if one surface has lead-based paint. If even one has lead-based paint. And in some instances, that surface could be an exterior window lintel that has no correlation to where a child may access it. Now, as Councilman Harsis pointed out, yes, that surface could still deteriorate, and if it does, we respond to that, we make it intact. Or ultimately, our desire is that that lintel is gone. And that's where we want to move the housing that we manage and control. But I know that this committee, as well as the administration for the city itself, desires that that be true for all housing throughout the city of Cleveland. It is a question of both commitment, of resources, of the capacity to do the work, but make no mistake where it's correlation to CMHA, that is our objective. That's why we were very emphatic about demonstrating the work that we have done, not to say that there's work that is yet to be done, but we are going to do that work.
And if I could just add, Councilwoman, very briefly, I will say I hear what you're saying, but also there is a possibility that because of some of the gaps in paperwork and analysis that your staff did, to the line of questioning I had earlier, that there could be elements of this that we don't fully know. I have not reviewed them. I don't know the level of how deep the IG went in terms of what your lead risk assessors did on the property, where they did not create a report, but they did indicate repainting. I don't yet have the comfort level that we can fully say what happened in those 5 instances where CDPH was not on site, but I understand what they're saying, but there could still be gaps there.
From the chair, just to the committee itself. So while I'm not trying to search for a justification for any of this, we had failures in our process.
Yep.
But what I can reassure the committee is that even in the instances that Councilman Marr just expressed, that we do know that those families did not continue to have a exposure to lead that then exacerbated or raised those lead levels in those families. So we know that as a fact. So while we cannot say...
I disagree.
Sorry.
You had 10, right? It was 10 that was not reported. Is that yes or no?
Chair,
10.
that's correct.
Okay,
That,
so
if I may, sir.
if you see one, you're doing analysis on you say, I need to take a look at so it won't get to 3, or let me to see where I'm at. You don't wait until it get to 10, then you don't. And my assumption, so whoever was monitoring and controlling, because sometimes with risk, things can change. You look at the instrument, you're moving in a certain direction, and if you see 1, 2, or 3, wait a minute, hold it. Something is going wrong here. And you could stop it from getting to 10. So somewhere it was a glitch, somewhere it was a chink in that armor when you did your risk analysis, and that instrument that you use, maybe it need to be changed or whatever the case may be, but you waited until it got to 10. You don't wait until it get to 10. So where you at, doctor? What you thinking?
So I got one more question.
Okay, I was just kidding.
Okay.
I'm passionate, I'm disappointed, but I hear the instruments.
If I may, to the chair. So once again, as I think the director has expressed, and everyone at this table shares, one instance is horrific.
Yeah, one instance
One
is
is too
crazy,
much.
it's not good.
What we're talking about is a accumulation of 10 over a period of 3 years.
Yeah.
There were 4 in one year, 4 in another, 6 in another. None of that is how it should be or how it ought to be.
Right.
But also to your point about risk correlation and risk assessment.
Right.
This is also not the same unit, not the same family, may not even be the same neighborhood. These are cases that are occurring across our entire inventory
but you know
of
what?
housing.
But if it's not, all of them are still in your scope. It's still in your paradigm. If I see something happening in a Huff, in Glenville, those are only political boundaries, same neighborhood. And then I need to make a move and say, this is happening in a Huff. So the odds or the probability is going to happen in Glenville or Fairfax, and then you look at lessons learned. Don't you agree?
Completely.
I'll yield back to you.
Yeah, so so as we having conversations, it's like, what do we do in the here and now? So that's on a solution basis.
We met on that. We're going to bring Clash
Yeah.
Richard Starr,
Right,
Councilmember
but
Richard.
this is my question.
Good job. All right.
My question. So, and I guess this is through the Department of Public Health, are there opportunities for us to, consider or doing more, I'm gonna say citywide testing or, just something to help to potentially ease people's concerns, understanding just our place, just we as a city having a much older housing stock. Like, what can we do on a systems basis to better identify our young people and families who do have elevated blood levels, as well as, using it as an opportunity to work in partnership with families and property owners to work to significantly reduce on a systems basis. That's kind of where I'm thinking, because again, based on what you were saying, if in 1 year, you are getting the cases where at least 300 children in the city of Cleveland are having elevated blood levels as a result of lead. This is a system every year. I just want that's the normal. Then we have much more work to do to get the number to 0, and that can only happen with a comprehensive approach in testing and working in prevention. So if you can kind of share, what does that look like to get to this system-wide community action, and what more of an investment needs to be made to make that more of the reality?
Sure. Yeah, through the chair to the councilwoman, thank you so much. We're on the same page on this. The key is prevention. So if we go and use the children as canaries in the coal mine, find out, doing all those blood tests, we're too late for those children. We help them to decline, but we really need to focus on getting 100% of our properties in the city of Cleveland lead safe. And so maybe I'll pass it to to Emily Collins, who can just give a high-level view of some of those strategies that we're implementing.
Through the chair to the councilwoman, the strategies we're using are a real retooling effort of the lead safe certificate program that includes things such as deploying technical guidance that helps with those private entities that we were all talking about prior to this, risk assessors, lead safe professionals who are assisting with this effort and a critical component. We need them to understand exactly how we are interpreting HUD guidelines, I should say, with respect to our own certificate program. That's one. Number two, we are working really hard to think through the lead safe auditor's role that you all put into law and make sure that we're getting a true audit that helps us refine, make more efficient, and evaluate governmental programming and processes to make our rental properties lead safe that were built before 1978. And I can go on. I know you all want to go on.
Yeah,
so.
and I get it. So with that, and this is the final part to the CMHA team, to the chair, to the CMHA team. With that, I believe it indicated that you all have like 10,000 units of CMHA housing. How many of those were developed between 1978? And my question is, again, what is the plan to get 100% of CMHA units to be to that point of lead safe?
Mr. Chairman, to the councilwoman, that's what we're doing with our redevelopments, much like the work we're doing over in Wade Park right now.
Mm-hmm.
The work we're doing in Wade Park right now is a comprehensive modernization. So we are taking walls down, and we are doing the common areas, and we're doing everything to bring those properties up to where they are. So the new units that we're doing across the city, like at Woodhill, and the work that we've done out at Riverside Park, those are the things that we're doing. It's just a pace of trying to continue to be able to do it and to secure the funding to be able to do it.
So with that, what is the extent of the 10,000 units that you have that fall into that category of being before 1978 and may not have the standard of what the city?
Probably somewhere over 6,000.
So you got 6,000.
Yeah. And even within that number of 6,000,
Mm-hmm.
we still have to go in and look to carve out some that may fall more so into the modernization standpoint, but we want to make sure that we are very, very accurate in identifying the proper numbers there.
And then I would then finally, through the chair to the team here of CMHA, with those like 6,000 units, this could again probably be an opportunity to partner with the Cleveland Department of Public Health as we look, because we know it's the units and the time that it will take to effectively modernize, and those will probably be a targeted place of where we can ensure that the testing is actually going on for any of the units that actually have families, to ensure those young, you see what I'm saying? Like, to target our efforts, knowing that we can't do everything all at the same time, but in places where we know there's still work to be doing, coming up with a comprehensive system to ensure, families understand how are the actions to work to be preventative. Also, at the same time, to ensure that we have the testing going on for our young people to ensure, so that we will know, because we know 300, right? Somebody's probably in that number, whether it came where, CMHA, just because of our environment, right? So that's where I will say, and offering a suggestion for the Department of Health, lead strategy, CMHA, let's work on that. Like, let's have that type of plan, focusing in on the units where our families are staying in those 6,000 units or so. I don't know all of them, but that have families, to work on the prevention and testing, understanding it is years away from having all of those 6,000 units to be up to the standard that we want in Cleveland and going from there. That's my suggestion. Thank you so much.
Chairman, if I may, I just wanted to clarify one thing that was made, a comment that was made earlier. There was a comment about if CMHA was aware of the 1 or 2 elevated blood levels, that there could have been things that we would have been able to do to stop 3 and 4 and 5. And that just simply isn't accurate. That would be making the assumption that the cause of those elevated blood levels was CMHA, and has already been reported and indicated here that CMHA was not the cause of those 10 elevated blood levels. So therefore, there was nothing, we need to be clear that the substantive work that needed to be done was actually done. The issue that, for instance, the IG's report indicated was when we talk about the report, if there's 10 elements of that report, we had the 10 elements, we just didn't put it into the type of report that HUD wanted that report to be. So there's not a question about whether or not CMHA was the cause of those elevated blood levels. That's the only way when you're saying that if we had done something after the second or third report, that we could have taken further steps to prevent a 4th, 5th, or 6th, or 7th report. There's not further steps that we could have taken to prevent the 4th, 5th, and 6th reports, because those elevated blood levels was not caused at CMHA.
But let me ask you this question. You saw the 1, 2, and 3 cases before we got to 10, right? Then you see, because you go to 10, and then you see 1, 2, or 3. Didn't that alert you because you were evaluating it? You just mentioned you were doing a risk analysis.
Correct, and I'll defer back to Chief of Staff Wade, but as you just indicated, that's assessing those risks and seeing these elevated blood levels over a 3-year period of time. Those are 10 cases over a 3-year period of time. But the suggestion was as if there was something else substantively that CMHA could have done to prevent there from being a 5th or a 6th or a 7th report of elevated blood levels. That's only if CMHA was the cause of those elevated blood levels. If those elevated blood levels were coming from that these are
Somebody
children
walking in with the shoes,
right, as you've heard about, there's many different causes or reasons for elevated blood levels that are not just paint, for instance. If those elevated blood levels was because they were using makeup that had lead in it or something, that's not a step that CMHA as a public housing authority could have prevented from happening.
But so let me ask you this question. So if you see 1, 2, or 3, then you start evaluating where did it come from, and then you document the evaluation. And so maybe when it hit 4 or 5, some of them you probably could have prevented if you evaluate, because the evaluation process will help you to take a look at it better so you can put it under the microscope.
Again, Chairman, there's no way then to prevent unless if the cause was CMHA, then I would understand your assessment about what CMHA could have done to prevent it. If the cause is not CMHA, and we've already determined through those 10 cases the cause was not CMHA, we couldn't prevent it. So that would be saying, for instance, if the elevated blood levels, as to give the example from Commissioner Harshad indicated, was from makeup, there's nothing CMHA as a public housing authority could have done to prevent that child from using makeup that had lead in it. There's nothing CMHA could have done to prevent that child from visiting a family that has lead throughout their house or chipped paint. So if CMHA was the cause of it, then CMHA can do something to prevent additional reports of elevated blood levels. But if CMHA is not the cause of those elevated blood levels, there's very little that we as a public housing authority can do to prevent a resident from engaging in other activities or going to other places where they may be exposed to lead. So I understand what you're saying, but I just want to be clear about the fact that just because there were, let's say, 4 elevated blood levels in 1 year, does not mean that there is something substantively that CMHA could have done to prevent a report of 5, 6, 7, 8, 9, and 10. If it was a CMHA problem, that meaning CMHA was the cause of those elevated blood levels, then I would understand. But if CMHA is not the cause, there was not something substantively we could have done to prevent those additional reports.
So let me ask you this question. So if I notice 1, 2, and 3, let's say it's not your cause. So you did what? Because you evaluated when they got to 3, and you did what? To make sure that they didn't get to 4. Even if it's not your cause, you should at least document it and evaluate it.
Mr. Chairman, to the councilman, I think it goes without saying that there is process things that we need to look at to make sure that we are sensitive to those issues. I think that's what it is. I understand General Counsel's point, and I understand the perspective that he's looking at it from. I also understand your perspective as well, which is that if you see these things going on, are there things that you can do, controls that you could put in to try to make sure that you could at least be in a better position to address those as you go forward? And that's what we're looking at.
That's exactly what I was just saying, because if I see something coming in my direction, I need to at least put it under a microscope to say, okay, and if it's not my fault, I'm not going to sit back and say, oh, it's not my fault.
Oh, no, I agree
Then what I'm going
completely.
to do is evaluate it and then try to put systems in place. I'm going to try to at least to deal with it, and it's documented through my processes. You know, you do when you do the process analysis.
Absolutely.
I mean, that's just me. I mean, that's how I look at things.
Absolutely.
Counselor.
Absolutely.
The council lady wanted to say 2 kids before. Is that okay?
Oh, I just wanted to add 2 things to Councilwoman House's. Is that okay?
That's all she wanted to do. Okay.
Thank you, Councilman Gray. You've been very patient, as has everybody at the table. I know this has gone on a long time. I just wanted to follow on one of Councilwoman House Jones's points, because you asked about opportunities for testing, and Director Margolius, you made the correct pivot to say that, you know, we want to move really to prevention, and then we went directly there. But I think there were actually some conversations about testing that I wanted to make sure we answered, because we made that pivot really quick. So I wanted to make sure you had the opportunity to speak a little bit about testing through the chair.
Through the chair, no, I appreciate that. I think I made my point earlier about the priority being to connecting to medical homes. And so, you know, Ivanka and Spencer and the CLASH team and I have had a lot of conversations about this. And we're not going to be on the same page, and I appreciate you all for that. But I as the health department, I think it's really important that we recognize our limitations, and for us to go and test just a 1-year-old for a lead level without doing the 99 other requirements required of a 1-year wellness visit, we'd be doing a huge disservice to the family. And so our priority is really working on connecting babies, families to pediatric medical homes instead of just the part about the lead testing. But we'll continue to have that conversation. I really appreciate CLASH's advocacy on this issue.
Thank you, Director. I didn't even mean to take you down that route, but just the work of the Screening and Testing Commission, for instance. And I noticed your conversation about the standard of care, which I think is actually a great accomplishment for the area. I have one last question. I have one last question for the CMHA team, and then hand it over to Councilwoman Gray. There was an opportunity in this report for CMHA to provide commentary on what HUD had sent over, which is sort of deep in the weeds in the appendices, and none of the discussion today about, you know, sort of you did the clearance, none of in CMHA's, and a little explanation about why you didn't respond to the IG report with some of the answers about what you say is the standard that was conducted on site, those inspections, through the chair.
Chair to the council, there was a process, and it's one that the Housing did not back and forth with the Housing Authority during the course of the audit. Much of what we have expressed today was during the course of those discussions, and that back and forth. There were not just a number, I believe, every single one of both our comments, our edits, I'm not sure how you could characterize it, that were expressed to the auditors did not appear in the final report. So that, you know, that is in the control of the Inspector General's office. Whether or not they accept the comment or remark, they do anything that would reflect the position of the Housing Authority in their final report.
Right, but on June 14th, you sent a 1 2, 3, 4-page letter expressing concerns and edits, and it did not mention anything about the repainting commentary that you've provided today. So could you explain why on June 14th you didn't find that was important to express to the IG?
From the chair to the councilwoman, I'm not sure that I've got an excellent response other than the fact that we had those discussions as I just overviewed, and that at this point this process was 18 months out from some of those discussions. It could have been just an oversight.
I will leave it there. Thank you, CMHA.
Council Lady, sorry.
No problem, no problem. It was a long day.
This is a special hearing. It's about the children.
I know how the importance of it, but I just want to say, as with you in your Glenville area, you know, with HAW.
Yeah.
Yes, and I kind of understand a lot of the lead programs. Just to say to our CEO, Mr. Patterson, you know, what is your plan moving forward, you know, behind this report?
Mr. Chairman, to the council person, we're going to continue to work both with the Department of Health, City of Cleveland, and other entities to look at our processes and procedures, make sure that we're in place and make sure that they're aligned. We're going to continue to do our redevelopment across to try to eradicate the structures that were built prior to 1978. We're going to work with our resident leadership and our residents throughout CMHA to get training, to try to heighten the awareness and the sensitivity to it. And again, we're going to reevaluate our policies and procedures to make sure that we get those things addressed. So there are 4 main points that we're going to be looking at, but within those 4 points, there are 3 or 4 other little subcategories that we're going to be working on. And we also have committed to have quarterly meetings with the Department of Public Health to talk about, you know, what we're doing and get suggestions in terms of things that we may need to consider. And I'm sure at some point there'll be an opportunity for us to come back and speak with council. I know the chairman mentioned that he was going to go out along with Councilman Starr and Councilwoman Maurer to go out to some of our sites and look and have some conversations about that. So for us, it's a good opportunity for us to work together, to collaborate. As I mentioned before, this is not necessarily just an issue that is germane to CMHA. It's an issue that is across the city as a whole. And we want to be a good partner to hopefully try to develop some best practices that we can use that could be also used in other areas.
Yes, definitely, and I agree with that. And I'm going to say this to echo you on that, Chair, to Mr. Patterson. I've been working with the Lead Safe Resource Committee, you know, with Kim Foreman for years. And I worked in the Glenville area. I worked with, you know, with the Buckeye Launchment area as well as Clark Fulton. So we had a program structure for years coming out the you know, what is it? Public health is a, you know, when Blaine Griffin, you know, passed the ordinance back in 2019. Yes, yes, and that's when that was created, and that's when I, could you come up, please? Come to the table, please. Yes, I joined forces. I apologize, I forget her name, but back then we joined forces to implement a strong program to get out in the neighborhoods for Karen, to get out in the neighborhood just for the reason what's going on at the table. So I want to say, yes, lead is, you know, the lead is across nationwide. So just hearing my colleagues talking about what happened at CMHA, you know, we've been out boots on the ground for the same reason of a lot of kids in all the areas had been tested, you know, with the lead level. So, and I worked with Robert Brown with her coalition having babies per se. Just to say this as a whole, there's a lot of different programs already been active for mothers and families to go through, even with the health, disparity, even with the food programs that the parents need to continue to go through to advocate to feed their babies the proper way, to give them exercise programs. There are programs that was created then that we, that we had community events for parents to come to in order how to clean their houses, as you know, because you was part of those events. But could you elaborate on the different programs that I think, Councilwoman House had asked, what else is going on to prevent, to help these parents, to take care of themselves. So could you collaborate on that a little bit, on those health programs that we created back then, on how to buy certain foods, how to maintain, your child in a better environment?
Through the chair, so I just, for the
chair.
health department, so Karen no longer works for this, so she's in building and housing, so I can take the health department.
Okay, but could you have her, I just want Karen to speak on that because she was part of the program with me in the Glenville area. I want you to take on that too, as well, because as well, I've been working with the director in Ward 4. I've been calling him because other parents have been calling me about their child have been had the leg level, and I was surprised that I had a lot of parents in Ward 4 been calling me actively, and I've been calling director, and he been helping me on helping the parents on what they need to do and where they need to go, to continue to help their child. But could you elaborate on that? Thank you.
Well, I know in the wonderful years that I did work for the health department, I was definitely out there. We had many different outreach programs. We had a lot of things that went on during Lead Week, which, by the way, I'm putting a plug in. It's coming in at the end of October. We'll be doing some things then. I currently do work in building and housing, but I fully support all the outreach programs still that the health department does, and I applaud them for continuing to be out there all the time. We wanted to emphasize all the outside things besides just your house and the dust and the dirt. We did want to emphasize health, and that eating the proper foods did help. If you didn't have a balanced diet, that lead was going in 3 times faster. We know that. And in all the times when I did go into CMHA properties, I'm happy I get the opportunity to say that I have never had a better cooperative group. I spoke with their risk assessor. We would meet together. We would do these inspections. They would take care of everything. Those children were tracked, followed, and obviously everyone knows sometimes when they moved into those CMHA properties, they already had a lead poison level that was not detected ahead of time. So that is why we were not finding much either, because they do keep their properties. There was never a time that I went in there and had any issue at all, and I wanted to make sure I said that. But we continue to work with the families, and in building and housing, we have a new program, the window and door program that's coming through, so I'm very excited about that. We will be helping everybody and anybody we can.
All right,
So.
thank you. All right, Chair, too. Chair, thank you for me taking the time, but Doctor, you can go ahead and speak on. No, go ahead and speak on the health programs, because you and I have been talking quite a bit
thank you.
for the last couple of months because of the calls that I've been getting in Ward 4 due to the kids having the lead screening and coming up with the lead testing, and I need your assistance, in order to help the parents to understand what they need to do moving forward.
Yeah, through the chair, thank you so much, and thanks for being such a great partner. And yeah, no, absolutely. I just didn't want to put Karen on the spot to speak to the health department's current role, but she did a great job. Thanks.
All right, you're welcome.
Thank you very much.
All right, so I just wanted to say to Mr. Patterson, it would always be good if the families that the families that have moved away and have not been followed up with any outreach program, I think that is that's something that needs to be looked into, so you can stay in contact with those families because there are health outreach programs for them to teach the families on how to take care of their children moving forward.
Mr. Chairman, to the Councilwoman, I understand.
All right.
All right, I'm gonna bring Clash up for a minute. No, wait a minute. Norman Edwards for about, what we give you, 3 minutes on here, and then I gotta end it with Clash. And are you on here also? Yeah. Gotta have comments. I gotta do the comments. All right, Norman, they'll do their piece. We have Clash to close it down. They'll do their 7 minutes, and then we'll be completed. Thank you. Top letter. Norman? Sir?
Yes, sir.
We'll listen to you.
Good afternoon, Councilman. I'm appalled at what I hear today. Okay, this is a shocking meeting, and I applaud council for having this meeting. It's inexcusable for CMHA to come down here, and this being in 2024, and we have a issue that the Inspector General, we're going off of an Inspector General's report from HUD. This isn't made up by me or made up by somebody from out in the street. And this is not about makeup. We're talking about painting over paint, if you read the report, and other incidents that weren't reported. And Councilman Maurer, your questions that you asked were very, no response, no responses to the accusations at all. I mean, how can this be for our black and brown and the white kids, for everybody, for this abuse? This is abuse. This isn't, you can't sweep this under the rug. It's not about makeup. It's not about, this is about lead paint, P-A-I-N-T. And it's inexcusable. These people are paid a lot of money, CMHA. Okay, the CEO and the staff and the attorneys that they have. Attorneys that they have that can't answer the questions from the Inspector General. And they came in today and they fluffed and they threw all of this and twirled all of this stuff around and just a whirlwind. And it's blown straight out of the window. Answer the questions that were in the report. They could not do that. Should have had the Inspector General's office come here and sit at the table with them and let them give these fluff answers. It needs to be changes at CMHA, and it starts from the top. CMHA CEO needs to be fired. Their staff needs to be fired. They did a horrible job for the citizens that they represent and the residents that they represent. This is terrible for the city of Cleveland. 2024, not 2014, not 2004, not 1994. We have to move forward as one. And you know, I'm appalled. I am embarrassed at the answers that were given. I sat down here, long day. I know you guys have a long day. I applaud the council people that called this meeting, Councilman Starr. I talked to you, Councilman Conwell, and I know how you are. Your questions, excellent questions. They don't have the answers. Councilman Conwell, you asked questions. They could not answer you about the 10 children. They fluffed over. They kept fluffing over. And Councilman Harsh, it was good that you threw in there are other ways about having lead paint or having lead in other. we're talking about the IG's report today, not other areas. We're talking about the paint that was on the walls that they covered up and repainted over. That's what the Inspector General's report said. They didn't say anything about makeup. They didn't say anything about lead being hidden under the bed or hidden somewhere else. So this has to be dealt with, and I think you start by firing people. We can't keep paying these outlandish salaries for an entity. And like I said, you have attorneys on their staff that sat here. I tell you what, I've never been so insulted at a meeting. I've never been so beaten down. And these are going to be helpless kids in our future. And they're not going to be around to help them. They'll be smoking their cigars out on the golf course. They don't care. And we have to start caring first. Thank you.
No, I'm all right. You're definitely right, man. You know, we should have brought in the IG. When we meet at Huddle, you should have brought in the IG. I don't know why I didn't think about bringing them in. They should have been here also. We'll meet, we'll Huddle, we'll discuss that. Is it Zay Burkhoff? Am I pronouncing your name right?
Zach Burkhoff.
You could, right here, sir. Thank you for coming, and thank you for putting out for the comments.
Thank you, Mr. Chairman. My name is Zach Burkhoff. I own one of the largest lead testing businesses here in the city. We've done more than 9,000 units. This looks like a huge problem. Much like an engine won't run without gas, you can't accomplish any of these things without enough inspectors. As of the last report that came out, 7 inspectors do 60% of the business in the city. My firm being one of them. Myself and my colleague, Mr. Macklin, would step up and try to, if you give us a block of 100 of them, we'll get you reports. We'll get you what you need. You need evidence. You need more bodies out there doing it, and we want to be part of the solution. Thank you.
All right, thank you. Clash. Pardon me? Yvanka Hall, you gave us some recommendations you left. We'll let you get the recommendations, and we already heard. About 5 minutes, 5 to 7 minutes. Yvanka will go fast.
You mean the recommendations that we have on the floor?
Yeah. You sit back and you listened.
So recommendation 1 was the Department of Health should conduct a program to test 100% of the children between ages 0 and 6 who are living in CMHA units that were built before 1978. It is clear from the HUD IG report that no one knows how many lead-poisoned children are currently residing in CMHA units. Child lead testing for CMHA tenants should be provided on-site and at times that are convenient for families. The Cleveland Department of Public Health has the resources. They have 2 mobile vans and the influence among private providers to assure the speedy implementation of this plan. CLASH is willing to provide volunteers to assist with the outreach and management of these health testing events. Recommendation number 2, the Cuyahoga County Metropolitan Housing should provide access for third-party lead-safe advocates access to CMHA properties and use of community spaces to provide lead safety information to tenants. CLASH is willing to organize lead-safe resource fairs at CMHA locations for a range of nonprofit services providers to answer tenants' questions and provide information. Further, CLASH will work with our partners at the U.S. EPA to present EPA's understanding lead presentation to tenants who are residents at CMHA properties. Recommendation number 3, Cuyahoga County Metropolitan Housing Authority should provide training for all maintenance and management staff in the renovate, repair, and paint training so that on-site employees will know how to identify lead hazards and how to use lead-safe practices. CLASH will work with our partners at the U.S. EPA to bring these training resources and materials to CMHA employees. Recommendation number 4. Council should take steps to make Cuyahoga Metropolitan Housing Authority subject to Cleveland's Residents First and Lead Safe Certificate laws, codified ordinance 365. A key factor that triggered the HUD IG investigation is the fact that HUD itself has failed to enforce its own lead-safe housing rule on public housing authorities. Bringing CMHA under the jurisdiction of these city ordinances will create complementary source of oversight for CMHA practices going forward. So those were some of the things that we looked at, and then one of the other things that came out was that when CMHA was talking, that their lead risk assessors are employees. And so I think that we should be hiring people that are outside of their employment status to inspect their residences.
I never thought about that.
We did, in the press release.
Yeah. We'll huddle with you, Director. You have a copy of that? I'm gonna take a look at that also. Well, Inez, you'll do a copy for me.
And you have one, I think. Spencer, you gave everyone a copy?
I think I gave mine to the woman
I have
from
it, though.
Cleveland.com.
I have mine. I have it.
You got it? Inez, who needs a copy of this? Right here. You did? Okay, good. But I already heard from you, Derek Wade. Sorry about your son again. My heart goes out to them.
But one of the other concerns that came up was around the testing, when you asked the question around the testing. So they only did a small sample of units that were tested.
Random
so that was
sampling.
a small sample. And so we need to make sure that all the units are tested and not just a small sample. The small sample was Spencer, let me make sure I'm right. Is it the 77 units were part of that?
I think that's right.
Sample? And
I
so
don't
there are
have that.
77 units, and we're talking about 6,500 units. And so only 77, there was not enough units that were
Yeah, that's
tested.
not enough unions for random sampling. I'm going to reach back out to you, Paul, me, Council Member Starr, Council Lady Rebecca Moore, and I, and with Patterson, we're going to visit the sites over there. And then after we visit the sites, then we'll have a sit-down conversation, creating some systems or strategy. How can we include the residents as well, Derek, with what we're doing? We got to do it after the 7th because council, we have a meeting of the whole. It's our second Wednesday, and we're going to meet that day to go over a lot of legislation. So you'll get a phone call from us, and then we'll host a meeting, and then we'll try to put systems in place moving forward from there. Because I don't want to have a long hearing without having some strategies that we can move forward with that.
Thank you. We commend them on the building of new units, but we have to understand the legacy of the legacy lead that is there, that is in those spaces. So as you build, the lead is still there, and so whether it's on the outside of the perimeter, as I was coming up Kinsman this morning to this meeting, I looked at one of the buildings that is right before we get to the highway area, Opportunity Corridor, and the whole outside of it needs to be cleaned, which means that all of the issues that are going on with the industry, the highway, all of the other particulates that are there are in not only on those buildings on the outside, but in those buildings. And so even if they are new properties, they still need to be tested.
Okay. All right. Then we'll reach out. We might even meet before we meet with Director Patterson, so we can put, some issues and concerns. We'll do an issue log. Any more questions? Because we're going to end this. How many hours will we here? How many? All right. It was good. We'll do the outcome measures because we really care about the children. Thank you very much with that.
Thank you.
The conclusion of Health and the Arts Committee is concluded.
Thank you.
on one of the votes. It should be 9 and not 19, but that can be dealt with. It's pretty clear that we don't have 19 votes.
Okay, okay, so we'll acknowledge that that needs to be changed. So let's call, so we're going to approve the meeting minutes,